confirmation of quorum.
Thank you, Dave. Good morning, everyone. Thank you for joining us. I think we will start with our friends who are joining us remotely, and then we'll go around the room. Thank you. Okay, so I'll just call your name if you want to just say good morning and a quick introduction. So let's start with Vicki Haifa.
Morning, everybody. Very sorry I can't be there in person today, but hope everybody's doing well.
Good morning, Vicki. We'll go with Susanna.
Hi, good morning, everyone. Susanna Idarola, Director of the Strong Center for Developmental Disabilities in Rochester, New York. Apologize also for not being in person. I just got in on a flight and couldn't make it to Albany.
Well, thank you for joining us. And then we'll say good morning to Bin.
Hi, good morning. It's Bin Fen from Queens. I'm a parent member. Thank you very much.
Good morning, Bin. And Dan Cunningham.
Good morning, everyone. Parent member Dan Cunningham. Good to see everybody.
Good morning, Dan. Deb, and I will just stick with Deb since I have a way
Stick with Deb. Good morning, everybody. Again, I'm sorry I can't be in person. Deb Tiviage from the Elijah Foundation from Long Island, New York. I run an autism organization, but I'm also a parent of a 25-year-old with autism. Good morning, everybody.
Good morning. And Jennifer.
Good morning, everyone. I'm Jennifer Thaw, and I'm the vice chair. I hope everyone's having a good morning.
Thank you, Jen. Josh Phelps.
Good morning, I'm Josh Phelps. I'm the Chief Operating Officer at AIM Services in Saratoga Springs. Sorry I'm not in person, just to jump out for a meeting midday.
Thank you. Val Gregory. I'm sorry, Val, we're not hearing your audio.
Sorry about that. Good morning, everyone. And sorry that I couldn't make it in person today. Also have a few items that are sort of on the deadline at work. I'm a parent. Look forward to today's meeting.
Thank you, Val. We do appreciate everyone taking time out of their schedule, remotely and in person. Thank you. And Dan Cunningham, I'm sorry, I did. Have you said hello? You did. I'm sorry. I'm just trying to say, Josh Christiana.
Good morning, everyone. Wish I could be there as well. My name is Josh Christiana. I'm the Director for Quality and Compliance and Chapter Relations at the ARC New York, and serving as the non-governmental agency representative for the council.
Thank you. Good morning, Josh. We have Kay Brockton.
Recording in progress.
Morning, everyone. CDD staff. It's fun to say the new acronym. Sorry I can't be there with you in person. I hope we have a great meeting today.
Thank you, Kay. You're missed. And Katrina, I see Katrina's joined us.
Hi, everyone. My name is Katrina. I'm a member of the council. I'm also a member of the caucus, and I also am the chair of the Individuals and Families Committee.
Thanks, Katrina. Good morning. And I believe, is there anyone I've missed remotely? Okay, great. Thanks. So we'll start in the room, Dave, if you wouldn't mind starting, and then we'll move to the right.
Certainly, Gina. My name is Dave Duell. I'm a parent and a brother-in-law, and I serve on the council as chairperson.
Thanks, Dave. I'm Gina Bullman. I'm the Public Information Officer and Special Assistant here at the CDD.
Good morning, everyone. My name is Drew Webster. I am a Communications and Grants Coordinator with the CDD. Good to be here.
Hi, my name is Maya Samuels, and I'm a graduate intern here at the CDD.
Hi, I'm Kira Topaski. I'm a contract manager here at CDD.
Oh, there we go. Technology. Hello, everyone. I'm Shamika Andrews. I'm the Community Outreach Coordinator for the Self-Advocacy Association, and I am the caucus chair.
There you go.
I'm Xavier. The
Good morning, everyone. Jackie Hayes, the Diversity and Inclusion Program Specialist with the CDD.
And good morning, everyone. My name is Sean Foltz. I'm with the Planning Council, and it's great to meet you all.
Oh, there we go. Peter Cole, I'm obviously a council member, a parent, and on the Community and Systems Change Committee.
I am Colleen Scott. I am from the Office for the Aging, and I'm not going to be able to get used to the CDD acronym. It's going to take me a while.
Thank you. Good morning, Jamie Harla here representing the New York State Department of Health.
Good morning, Julie Veneman. I'm the policy manager at Access VR.
Good morning, Allison McCarthy, New York State Office for People with Developmental Disabilities, Office of Strategic Initiatives.
Good morning, Sue Swan from the New York State Department of Health, Division of Family Health, and the Bureau of Child Health.
Good morning, everybody. This is Julie Keegan from Disability Rights New York.
Good morning. It's Eileen Borden from the Office of Special Education. I'm one of the managers there, and I oversee our due process and our policy unit.
Good morning, I'm Mariela Adams. I'm a parent member, and I'm also program manager at the Westchester Institute for Human Development.
Susan Fox, I'm the CEO of the Westchester Institute for Human Development, one of the 3 New York USEDs.
Good morning. I'm Joanne Siegel, and I'm the co-director of the Rose F. Kennedy USED located in New York City. Thank you.
Talk about technology. Vincent McLaughlin, new member of the council, someone with autism, and happy to be here.
There we go. Morning, my name is Jennifer Goldman, and I'm the federal liaison at the CDD.
Hi, folks. Jesse Kendall, Fiscal Officer for the CDD. Happy to be here with you today.
So thank you all. Dave, I'm happy to report we are meeting quorum, so I'll turn it over to you for the agenda.
Excellent. Thank you, Gina. Please allow me to quickly review the agenda for today. From 9:30 to 9:45, Gina Bullman will discuss the Zoom platform and our procedures for voting. We'll also vote to approve the June 15, 2023 minutes from 9:45 to 10:15. We'll have 2 funding motions to consider. We're moving the 3rd funding motion until after the presentation from the University of Rochester in the afternoon because it directly relates to that grant. From 10:15 to 10:30, Jen Goldman will give the required annual conflict of interest training. There's an attestation form you will need to sign after this training, which is in your packets. It will be emailed to those attending remotely. From 10:30 to 10:45, we'll take a quick break. Restrooms, right outside the door, what do we call these general restrooms to the right, an accessible restroom down left to the end of the hall, and a quiet room down toward our right here. And you can just look down, you can see the doors open and the light is on. I was just there a minute ago. So from 10:45 to 11:15, we will hear leadership reports. From 11:15 to noon, Jen Goldman will give a PPR update and a vote will be required. We will then take a break from lunch or for lunch from 12 to 1 out in the courtyard. All members kindly return promptly at 1 o'clock. From 1 o'clock to 2 o'clock, we'll have a special presentation from the University of Rochester Apprenticeship Program. From 2 to 2:45, Jackie Hayes and Kim Berg will go over program priorities for our state plan. From 2:45 to 3, we will discuss funding motion 3 and adjourn after. I'd like to mention that we have available to all members and staff attending in person the studio room. That's the quiet room that I was discussing earlier. And it's located right outside and off the courtyard to the right. And you can use that throughout the day for making phone calls, doing work, or just getting a quiet moment. We have a tight agenda today and will not have time for our usual open forum at the end of the day. So if you have something to share, please do so now at this time. Colleen?
Yeah, I always have something to say. No, I just wanted to mention that I am heavily involved in the master plan on aging. If anybody has not heard about it, it's a governor's proposed initiative, co-spearheaded by the Department of Health and the Office for the Aging. And there are listening tours coming up. I can send the information to you and then maybe you can share with people. But we're all aging from the moment we're born. So it's really important that we think about what services are needed for individuals with disabilities and those over the age of 60. So everybody's voice is important.
Thank you, Colleen.
Thank you.
Shamika?
I just wanted to share that I'm excited that after even though this week is a little crazy, after I leave here today, it's the first day of the SANES conference. So we're all looking forward to that. It's the first time we've been in person in 4 years, and we're expecting 600 people to take over the Marriott for the next 3 days. So we're really excited. And I know a bunch of you are going to be there. So I'm excited to see everybody in person.
That's encouraging. Thank you, Shamika. Others? Okay, if there are no others, if there are no other concerns or questions or general comments, I'll turn the meeting over to Gina, who will now go over some of the functions of Zoom and we'll discuss the voting procedures. Gina?
Thanks, Dave. I think everyone on Zoom is pretty familiar. If you have a question or would like to participate in the discussion, you can physically raise your hand or use the raise hand function in Zoom. You can also put questions in the chat, but do speak up if we're missing something. And for voting around, for those participating, we'll call for all in favor, any opposed, anyone abstaining. Please raise your hand in person. And again, if you're on Zoom, you can use any of those functions, which are raising your hand physically, using the raise hand function, or you can note something in the chat. I think that's probably all we need to know for voting. For those in person, we've already been through this with our welcomes, but as you can see, the turning on your microphone is that center icon. Please turn it on when you're speaking and turn it off when you're done speaking so that we don't have a lot of feedback in the room.
Okay. Thank you, Gina. Now I'll turn the meeting over to Jen Thau. Jen?
We have a few things to do to take a look at and make votes on. The first thing is the minutes of our last meeting are on pages 5 to 7 or 8 in our packet. It says 5 through 8. I'll give everyone a moment just to take a look at those.
So I'd just like to make a note, if you are a new member or if you were not present at the last meeting, you can abstain from voting on the minutes, and you can, we'll call that after all in favor and all opposed. Thank you.
Thank you, Gina. Are there any suggested changes or edits to be made to the June minutes?
Not seeing anything from anyone remotely or in person at the moment.
Okay. Thank you. Who will make a motion to approve the minutes?
Shamika on the motion.
Wonderful. And who will second the motion?
Sue seconding.
Okay, let's bring it
Wonderful.
to a vote if you're ready. All in favor? And it will take a moment to calculate the vote, so please keep your hands up. Gina has to see who's raising their hands online as well as here, so it's a little bit time consuming. Okay. The minutes of the. Oh, yeah, I'm sorry. Opposed by the same sign. Thank you, Gina. Anyone need to abstain?
Abstain.
Okay, Vincent, Mariella. Thank you.
Eileen, yep,
Yes,
and Julia.
yes, thank you, Eileen.
Okay. Thank you.
All right. The minutes of the June 15, 2023 full council meeting are approved. Jen, back over to you.
Jen, I don't know if it appears you're still muted. Thank you.
Thank you. We have two funding motions today that will be read. I will ask for someone to make the motion and someone to second the motion. I'll provide time for discussion and then call for a vote. There are recusals on some of the motions of which we are already aware. Please let me know if you need to recuse yourself from deliberations and voting. We will allow time for members in person to leave the room and those attending remotely to be placed in a breakout room. Members should recuse themselves if they have a conflict of interest or to preserve their option to apply for funding. Moving right along, motion 1, Health Equity Special Olympics from the Community and Systems Change Committee. Does anyone need to recuse from this motion?
I'm seeing no recusals, Jen.
Oh, okay, thank you. And Joanne, would you please read motion 1?
Oh, I'm sorry, Jen. Joanne, if you could use
so
your.
sorry.
microphone.
Sorry about that. Okay, motion 1, state plan goal 3.3, targeted disparity to fund the Special Olympics of New York, Sony, $100,000 a year for 5 years total. The grantee will use funds to expand healthy athlete screenings and referrals to underserved areas of New York State.
Great. Jackie, will you explain the motion, please?
Yes, thanks so much, Jen. So a little bit of background. As you might remember, we had the Special Olympics of New York come and present at our last full council meeting, just kind of sharing a little bit about the program work that they do. And I know for us, you know, we have in our state plan a goal and an objective around targeted disparity, which is, you know, basically focused on low-income families and individuals with developmental disabilities. And, you know, one of the, you know, disparities for people with developmental disabilities, which is more significant for people from underserved communities, is around health. So access to healthcare providers that are proficient and competent in serving people with developmental disabilities, that take Medicaid, that, are comfortable working with people with developmental disabilities. That's definitely a need that we know exists. And so basically what this program would do is the Special Olympics of New York would, through their healthy athlete screening program. And so what they do is they basically screen for a number of different health areas. That includes just a general physical exam, as well as screening for a number of different areas like vision, oral, dental health, podiatry, among others. And those screenings are really important because they help to flag issues that someone might not be aware of or maybe hasn't been addressed previously. And really, the goal is to ensure that people with developmental disabilities have good quality healthcare and are connected with specialists when issues arise in those areas. And so that Healthy Athlete program exists now, and really what our funding would do is to expand programming to underserved areas of New York, which include the Southern Tier, North Country, Bronx, Brooklyn, Queens, as well as the cities of Buffalo and Rochester, to make that kind of program available in underserved areas and really target those areas. And so really they have a multi-pronged approach to this. So part of it is increasing that screenings in underserved areas, but it's also creating an up-to-date provider directory of, physicians and healthcare partners who have experience and competency working with people with developmental disabilities. They will monitor those referrals with specialists to make sure that, basically they went well and that there's outcomes as a result of that. They also want to, with our funding, recruit and train 15 to 20 new clinical directors in each health discipline. So, increasingly building the competency and capacity of healthcare professionals to serve people with developmental disabilities. And then another part of the grant would be also surveying healthcare professionals on what are the barriers and issues when it comes to them serving people with developmental disabilities, to get a better understanding of some of the challenges or some of the attitudes or other issues among healthcare professionals, in order to really target and address those from a research-based approach. And then they're going to provide a final report to our council on the outcomes of that grant as a result. So, really the overall intent is to increase the number of screenings, healthcare screenings in underserved areas of New York, with really the intent of increasing access to healthcare for people with developmental disabilities in those areas, as well as really increasing the capacity of healthcare providers in those areas to better serve people with developmental disabilities. A few of the questions that came up at the Community and Systems Change Committee and then the Executive Committee, one of the questions was, how soon could Special Olympics get underway with implementing this grant? And so they have games in the winter, summer, and fall. And with how much time state procurement, like if the council were to approve it and we work to get under contract, I'm thinking that by summer 2024 is probably when the earliest that we could implement it, which I think, for state is actually pretty fast. So I think we could get it up and running fairly quickly, and I think they could as well. And then there was a question about how the referral process works. So really what that looks like once someone is referred through the Healthy Athlete programs, how does the Special Olympics follow up, and what are the next steps? What happens then? So the Special Olympics basically provides that athlete and their family or whoever, needs the inclusive caregiver directory. So kind of sharing the directory of doctors or healthcare professionals that they know to have a capacity and competency. And then the Special Olympics will follow up with that athlete and their family 1 month and 3 months after the screening via text or mail to find out how it went and make sure that things went well. Another question that came up at the committee level was, what information do they take into consideration when including caregivers in the caregiver directory. So how does someone become included in their caregiver directory? So their qualifications include experience working with people with developmental disabilities. That's one piece. Training through the Special Olympics. So they train providers on serving people with developmental disabilities and taking that training as a part of it. And then the provider must accept at least one form of Medicaid. So those are the criteria in which they become included, you know, the minimum criteria for being included in the provider directory. And I think Dave, you might have asked this question too, like how do they make sure that the referrals are objective, that it's not, you know, that there's no conflicts there or, so, you know, basically they do have those qualifications. So that is part of, you know, they need to have that training. They need to basically accept a form of Medicaid, but that really, you know, and have experience working with people with developmental disabilities, but they do want to develop that formal working agreement with them. And they actually have providers sign an acknowledgement agreement that outlines the expectations of being included in the directory. So that is, you know, there's no kind of like priority for some, you know, it's really just about how well they serve people with developmental disabilities if they've gone through the training, and that's how they get provided or included in the directory. And then those, you know, that comprehensive directory is what's shared with the athlete and their family. So that those are some really good questions that came up from members at our committee meetings. And if anybody has any questions, I'm happy to provide more information as well.
I have one.
Yeah.
So one area of the state that you left out, when you talk about the Southern Tier, North Country, the city, what about the Hudson Valley? And if it's not going to be included, will it be considered in the future?
Yeah, that's a really good question. So we did focus on areas where, you know, basically there was data about low income or rural areas, but I think that's something, you know, this is in some ways kind of an expansion, and we can see how things go. And I think if, you know, we do more research and find out there's really a need in the Hudson Valley too, like underserved communities in the Hudson Valley, that's something that I think in the future we definitely could consider.
Yeah, because I know there's a big need, or at least I see it, there's a big need, especially in the area I come from, down in Ulster County, especially in the city of Kingston. There's a big need right now for this kind of services. So anything you can do in the future, I mean, for the area of the state.
Yeah, and I'll go back too and see what kind of program they have in Ulster County in the Hudson Valley, because if they, you know, I can ask that question to see what exists currently and definitely like help. I'll share that information after the meeting too with you as well.
Yeah, if you want to have more of a conversation offline, we can certainly do that.
That would be great. Thank you. Yeah, Ben.
Yeah, hey Jackie. So you know, this is the concern we have consistently, and we actually very worried about. We have a you know, parent organization. We target the young adult. We see that the health concern is big because one of the reasons they don't have enough opportunity to exercising and the sports, anything there. So from this proposal, right? What I see is it seems like focus more like going to the healthcare professional agency, organization specialist there. But as I know is that most of the job actually done as locally is by the community organization, like a parent organization, community organization. We organize couple of this exercising together because, you know, I think lots of children have experience going to Special Olympics, but that's only once a year. What happened after that? I don't want to do that. I don't want to just have one chance going to Special Olympic. I want to have a regular exercise opportunity, which is achievable, which is we can do it locally by the family member, by the community-based one there. So I really want that this project also concern supporting the community level, community organization, like by parents, by family. We can do some of the sports, exercising locally, almost daily, maybe. I think that's more important for us rather than developing a Special Olympic as a whole program of that. So I wish that this program have considered supporting that part of them. Thank you.
Great. Thank you so much, Ben. And I think that's a really good point. And maybe there's, in talking with the Special Olympics, maybe there's some ways that we can work with them to see, are there connections with community-based organizations at the local level that you can partner with to do programming. So that's one part, but I'm thinking too that in the future, that could be a potential future project as well, is really maybe even something like small grants at the local level to support health or fitness programs that community-based organizations could implement on the local level. So that might be another route in the future too. But I think, most immediately we could, potentially reach out to the Special Olympics and see if there's some way that they can partner with some community-based organizations to, do some programming, that, like you said, is maybe someone doesn't want to, go to the level of like competing in the Special Olympics, but maybe just wants some daily activity or, maybe something like that could come about.
Okay, great.
Sue.
Okay, Jackie. I have a few questions, but they don't all have to be answered right now. I will email you as I always do after these meetings. My first question is, how are the referrals from this project going to equate into access to care, especially oral health care? That's number one.
Yeah, that's, I'm curious to see that information too, because I think that's something that we can build into like the evaluation component to kind of say like, okay, if you're following up at that 1 month and 3 month period after a referral has been made, asking that question, like, was it successful? Were you successfully connected with care? So I think those are some things that we could build into the project and kind of learn more about like how, like you said, like how effective, because we know there is a big issue with oral health and dental care. And that's something that we've heard definitely in rural areas and, more remote areas where it might be like, there's one dentist or, and that's like a big capacity issue. I will say too that later in the meeting, we have like basically members are going to give us input on priorities. And one of the specific projects is around dental and oral health. So that's something too that I think, because I think there needs to be focused work just on that area as well. But we could learn, I think, a lot from this grant on just seeing, because I'm curious to see that too, especially in some of the underserved areas, like where are the breakdowns happening, and getting a little bit of a better understanding of the issue too.
So have you looked at the health provider shortage area data and the dental health provider shortage area data? It's DIPSA and HIPSA.
I have not, but I would love to.
Okay.
That would be
a
helpful.
good start. And then my next question is, so for the minimum 11,000 athletes screened over 5 years, is that accounting for duplication, or are they going to be allowed to be screened more than once or annually? How's that going to shake out?
That is a good question. I think they gave, basically there's some targets that they had set where I think that's, it's starting with like 1,600 and then it's going up over the 5 years by a few hundred people. But I'm not sure if they keep track of like, has this athlete been screened before and ensuring duplication. So that's something that I can ask about.
Yeah, okay. I'm not thinking that there's anything wrong with duplication. It would just be interesting to see of that 11,000 or more or less, whatever they get to, how many were duplicated and unduplicated. Thanks. I'll do the rest via email.
Thank you so much. And thank you for pointing us to that data. That's really helpful.
Other comments, questions?
I'll just add,
Julie.
and although I'm not a you said, I will say anyways that I think it's really hard to get medical professionals to recognize the needs or invest in the needs of people with developmental disabilities. But I think a lot of people know about Special Olympics and are, supportive of it no matter what goes on. And I think using that as a springboard to sort of get their attention, to listen and pay attention is very effective. So I like the angle that this is using, and I think it might be more effective to reach medical providers than other ways.
I just want to
Tran?
make another comment in terms of what was just said. In our borough, in the borough of the Bronx, the poverty level and the representation of individuals from of color are very much prominent. I was just looking at some statistics, and we have over 84% of the individuals living in that borough as either identifying as African American, Black African American, or of Hispanic background. The Special Olympics has been in the area. They do connect with the, and from my experience, I can only give you from that perspective because I chair the Bronx DD Council. They work with community organizations. It is a voluntary type of setup. So the organizations have to agree to participate. When it was really functioning well, which was a number of years ago, and it depended on the community agency's capacity to work with Special Olympics, they were providing trainings every week. But the caveat was with Special Olympics, the families have to bring the individual to wherever the community center is, wherever they're going to have their training sessions. So, I mean, it is a very much based on community involvement. That's really how they were. And because their staff then supplements with the trainings and working with the staff that may be doing, working with the Olympic, with the athletes. So I just want to mention that because I don't want to give the wrong impression. I don't want the impression to be that they don't link with community organizations. And just to tie in with what was said, and people here know because I've mentioned it, we're working with medical school students at Einstein. And those students that are interested, because again, we want to hit young professionals who, number one, have the time, and number two, really might have an interest, particularly what we're finding is they have family members. Those individuals are doing the screenings, and we've been able to work with other medical school students throughout the area that might be interested. And there's going to be a screening done in Javits Center. And that's so that they can do these annual screenings. I just want to give that background because, I know that people are not on all the committees, didn't hear the conversations that go on. So I just wanted to mention that.
Here we go. Follows from what I said before. In the county where I come from, okay, we have one main clinic that serves those with disabilities, okay, for a county with 188,000 residents. Sometimes it takes months, and that's on a good day to get somebody in for even the first time, or even for for specialty care. I think with all due respect, and don't take this how it sounds, it seems like the Hudson Valley gets shut out in the cold all the time when it comes to various things. I'm not talking about this particular, but I'm just saying in general. And, we need to help down there now. Okay. The people with disabilities need the help down there now. And this sort of program would be critical to moving things along, because we have a lot of underserved areas, especially in the city of Kingston and the southern areas, and also over in Dutchess. I get calls all the time. I find out about it all the time. And so, it's frustrating, and I get vocal about it all the time. It's like, okay, you got Southern Tier, the North Country, the city, well, we're out. And that bothers me. So, I don't know. Just like I said, there's one main clinic for all the thousands of those with disabilities, and this would, I think, help the situation out a lot. And it's too bad that it's not going to be dealt with now.
Thank you, Vincent. Katrina?
Katrina has a comment in the chat, and then I see Shamika, you have a question.
Okay.
So Katrina's asking, are these screenings, or do they allow the athletes to have access to future medical care as well?
Yeah, so the screenings from the athletes, basically, if there's an issue that's identified, let's say it's having to do with vision, someone needs glasses or at least needs eye exam, they will basically connect them. They will share the healthcare provider directory, that is vetted by them, and then follow up in, that 1 to 3 month period. And some of the staff did share with us, just some of the stories of, basically some of their athletes who have had glasses for the first time, or, had gone to the dentist for the first time as a result of the Healthy Athlete Screening Program. So we know that has been, a significant outcome of the referrals. And I think this grant will help us learn to, in kind of ensure and looking at when those connections happen, if they aren't happening, an understanding of some of the issues. So I hope that answers your question, Katrina. And then I just wanted to say, Vincent, too, I think that's a really good point. And, one of the things that's so valuable from our members is just sharing, the on the ground, like, what is it like in Ulster County? Because I think sometimes it's tough for us to know, like, we can look at research, we can look at data, but it's very different when you hear from families or self-advocates saying, this is what it's like in my county, this is what the experience is like. And so, and I think we can do future programs in that area. So, I just wanted to say thank you, because your input is really valuable, and your experience is really valuable and so important to inform our work on the council.
Shamika?
I just wanted to say, because I don't know if it's clear that this grant focuses on people that are participating in Special Olympics. It's not an overall health screening for anybody. It's just people that participate in Special Olympics. So I don't know if that's particularly clear to everyone. But.
Thank you, Shamika. Allison, is that you?
Yep.
Oh, Mariel.
I don't know if you've
Wasn't
spoke
sure.
at all to or thought through the sustainability, like beyond the project. Does it continue? Is the provider directory, will be shared more broadly to really engage and continue the engagement of those providers? But just curious.
Yeah, I think that's something, definitely the provider directory is something that we'd want to share more broadly, and, I think be a good outcome and thing that could be sustained, or, sustain the project. And then, I think in terms of sustainability, that's always kind of a challenge with our grants, but I think, some of over the 5 years, the training of the, clinicians, if there's 15 to 20 new each year, then we're hoping that basically those healthcare providers, are now serving people with developmental disabilities. And so in terms of the future, it would, I think it would be great to continue that, but, it's that 5-year investment that we're thinking those would be kind of the outcomes. So, we basically want the connections, the building of the capacity of the healthcare providers, and then that directory, I think, will be kind of the long-term impacts of this 5-year grant. And then, I think we learn a lot anytime we're, piloting something or expanding something. So, Sometimes there's room for, new work or new needs come up or new areas of the state that, weren't included before that we think about as like a sustainability of like, can we expand into new areas? So I could see that potentially coming out of this grant as well. Thank you, Allison.
Mariella?
Mariella?
Oh, wait, I have a follow-up question to, or just a suggestion. So I assumed that it was 15 to 20 total. So in that bullet, then, should it be 15 to 20 a year, new directors?
Yeah, 15 to 20 a year.
Okay, that's great. That's much better.
Are they going to be doing some community education in terms of having families consent to the health screenings before the Special Olympics? And will they have these consent forms in different languages, given that this is an underserved population? And also, typically for Special Olympics, parents are not required to be there. So will parents have a choice to attend the health screening?
Yeah, I'm pretty sure they have a consent form in place, but if I can make sure that that's the case, and then I think absolutely we can include in any sort of agreement that it would be translated into other languages, especially the top languages spoken in New York. I think that's something we can definitely build into the contract if the council approves. And then I can follow up and ask the question about family involvement too, like if the family needs to be there at the healthy athletes at the screening and get more information about that.
I have one follow-up, last one. Is there a provision that we can build into the contract that says where possible, the program could be expanded into the Hudson Valley if funds permit?
Jump in there, Jackie. I don't think that's something that we could do. I mean, really what Jackie's saying is we're gonna, circle back to the Special Olympics, look at the data, and certainly if the data supports the need to expand, we want to look and see exactly what's in the Hudson Valley, but we can't just write that in our contract without any basis. But we're hearing your concerns, Vincent, and absolutely we'll be circling back to Special Olympics and seeing what we have and what is needed in the Hudson Valley. So I really appreciate your advocacy on that. But as everybody knows, I am the timekeeper and we're really running way behind. I don't want to rush through these great questions and discussion, but unless anybody has anything else pressing, I would like to bring this to a vote if that's okay. But again, I don't want to.
Shemika has another question.
All right, go ahead, Shemika.
And it's not a question. It's just, I just wanted to say, based on what Vincent just said, that just because this particular grant can't be changed or expanded doesn't mean that we can't come up with something else that would fit other people outside of Special Olympics and other things, other health concerns that are outside of Special Olympics. So even though it doesn't fit here, it could be a future project.
Yep, great point, Shemika. And again, this is a 5-year grant, so we're going to be working closely with the grantee. And certainly, if there's that we look at the data, and if there is a gap there, certainly that's something that we can look at over the 5 years in that region as well. Okay, thank you.
Great, thank you. Any other questions, comments? If not, Jen, over to you.
Thank you, Dave. Is there someone that will make the motion to bring this to the vote?
Sue on the motion.
Thank you, Sue. And is there someone who will second?
Sean Fultz, second.
Okay, shall we bring this to a vote? All in favor?
Yep.
Okay. Any opposed? Okay. Vince is opposing?
Okay.
Thank you, Vince. Any abstentions? All in favor, say aye, please. The Health Equity Special Olympics funding motion has been approved. Jen?
I'm sorry, before we go on, can I just clarify if there were any in opposition or abstentions for the remote participants? In opposition first? And any abstentions for remote participants? Okay, there were lingering hands. Thank you very much.
Okay, Jen, back over to you.
Moving right along, it is time to take a look at motion 2, which involves housing. It's multicultural housing navigation, and was part of the Community and Systems Change Committee, a motion that they put forward. Does anyone need to recuse? I think we have some people.
We do. We have, thank you, Jen. We have 2 recusals, so, thank you. If you could just give it a minute, do we have the breakout room set?
So Josh, I know you need to recuse from this as well remotely. We're going to be putting you into a breakout room. Once we are through with the motion, we will send you an invite to come back into the meeting. If you're not there to accept, it'll just automatically bring you back 60 seconds after we make that request. So I'm going to put the request in for you to join that breakout group room right now.
I'm sorry, Ben, did you have a question? Or
Yeah, so I checked that one. I probably will recuse myself as well because we probably will be participant later. So I'll also request to recuse.
All right, I'll assign you to that breakout room as well.
Thank you.
Right, we should be all set with recusals.
Excellent. Thank you, Drew. Jen?
And Joanne, would you be so kind as to read the motion for us?
Sorry. State Plan Goal 3.1 Developmental Disabilities Systems. The CDD will award up to $50,000 to eligible community-based organizations to recruit and support bilingual candidates to become trained housing navigators.
And Drew, would you please explain the motion for us?
Absolutely. Thank you, Jen. So this motion had gone through, as Jen had mentioned, the Community and Systems Change Committee, as well as the Executive Committee. So I'm going to share a bit of background on this motion itself, give some feedback that we had received from both committees, and then we'll open it up for questions. So this motion is looking to make available up to $50,000 to work with community-based organizations, specifically who serve communities that either have limited English proficiency or speak English as a secondary language. The intent of the funding is to embed certified housing navigators within these organizations and within these communities. So what is a certified housing navigator? We'll start with what is housing navigation. So housing navigation, as it sounds, is working directly with a person with a developmental disability, their family, their circle of support to navigate the housing options that they have in their region. That'll be very region dependent because housing looks different across the state. That will also, it also encompasses both certified and non-certified housing options. So really, the whole discussion between the person, the circle of support, and housing navigator starts with the person, their wants, their needs, and really looking at what's available and what is possible, depending on what they are looking for in terms of housing. I also think it's important to recognize that housing navigation as a service is recognized. You can utilize self-directed funds. And last I know, OPWDD was also looking at housing navigation as a potential service to be added to the Medicaid waiver. So it is a recognized service. You can use self-directed funds to support utilizing a housing navigator. They are the ones who actually work directly with the person through the housing navigation process. So how do you become a certified housing navigator? So there's actually a 10-week intensive housing navigation course, which is offered by the New York Housing Resource Center, which is under the New York Alliance for Inclusion and Innovation. So we're specifically looking to use these funds to go directly to these community-based organizations to either recruit somebody within their organizations or within the community that they serve to take the housing navigation course and to become a certified housing navigator. As we know, housing in general has become very difficult for anybody to access due to affordability and availability. That is compounded even more so if you are a person with a developmental disability, and even more so if English may not be your primary language. So we're really looking to get resources into these communities, knowledge into these communities on what's available what's available for them in order to navigate and find appropriate housing depending on their situation. As an agency, we are often hearing with the community-based organizations that we're connected with requests on housing. Any information on housing. It's always we have folks who need different situations. Where can we turn to? What can we do? What information exists? So we're often pointing again, folks, over to the New York Alliance for Inclusion and Innovation because they have a fairly robust resource and network around housing. We also, if OPWDD has not currently been connected with them, we'll send them their information. And I know both have been very accommodating to do presentations, to give resources, but we are definitely seeing a need for more experts within the communities themselves, as well as within these organizations to start embedding that knowledge base of housing within New York State and how it operates right into the communities that are serving people with disabilities and their families. All right, so that is pretty much a summary of what we're looking to do with the funding. I do want to address a couple of the questions that came up at both the CSCC and the executive committee meeting. One question, which I think was from you, Mariella, at the committee meeting was, are these trainings offered in a language other than English? So currently, no, the New York Alliance does not offer the course in any language other than English, which is why one of the criteria of the folks that we're looking to recruit to take the program would be for them to be bilingual. That's kind of the approach to bridge that language barrier to access this information, really as a jumping off point. So we're also hoping that the folks who are participating within the course can offer feedback to the Alliance to make it their course more inclusive to different communities, different cultures, different languages. And our funding will also support the person's participation. So if, again, we're looking for bilingual recruits, but if they are not confident with their English, we want to be able to have resources available for them to support and meaningfully take this course and to learn the information that is being offered. Additionally, we don't want to just see the person take the course and then, what are they doing next? Mm-hmm. Part of the grant funding would also be to evaluate the person's participation within the course and support them to start utilizing that information and embedding it within their organization. And then kind of a longer term effect would be actually working with people within the community who are looking for alternative housing solutions. And that would be, kind of a down the line objective. We also had a question from Joanne at the executive committee meeting, how are we going to identify these organizations? So there's going to be a few different methods that we go about. One, we have through the work of Jackie over the last several years, really been able to connect with a fairly robust network of community-based organizations serving different communities who speak different languages. So we do have kind of a current network of folks that we would start the engagement with, but we also recognize there are communities throughout the state that we probably aren't currently connected with. So we do want to tap into the Office for New Americans, which is through the Department of State. Cynthia Stewart, we actually have a grant with them. She is a developmental disability navigator within the Office for New Americans. So she kind of looks at, the DD system and how it interfaces with the New American system and really can help us identify communities who may not currently be informed of who we are and what we have to offer. As well as, and Jackie, you may have to help me fill in the gap here. NIAMP, can you give a little background on them?
Yeah, so it's the New York Association of Emerging and Multicultural Providers. And I think some people might know of Vet Watts. And so I know in the past, we've also connected with her and she can distribute information or resources to her network or their network of multicultural providers. I know when we were doing the COVID report, We relied on them and they were excellent to connect us with a number of multicultural providers and community-based organizations serving diverse communities across New York.
Thank you, Jackie. As well as we would be connecting with Hira Mira, who is the Chief Diversity Officer at OPWDD. So we have a few different channels that we'd be looking to go through. You know, if there are recommendations from the councils for different organizations that you can think of, we want to be very fair with the distribution of funds and reach different communities across the state. But that is our plan, and the intent of this motion is really to start getting knowledge on different housing resources in communities who have not in the past received it. And it's actually been very encouraging because a lot of folks are reaching out to us. So people do want assistance and information from a state agency. So I think that's very encouraging to hear as well, that you know, they're coming to us for this type of request. So at that point, I will open it up for questions and comments. And I see Sue right off the bat.
Yeah, I don't know if I missed it, but how will this money flow? Will individuals apply? Will community-based organizations? Will it go directly to the Alliance?
So no, it's going to go directly to community-based organizations. And given the funding amount, it does not need to be a competitive grant. So we're going to be able to go directly to these organizations and start having that conversation. And, you know, again, it's going to depend very much on the organizations themselves and their capacity. You know, some organizations may serve a large, you know, they may be larger in nature and be able to support more people to take this course. So we could support a few people within an organization to go through the course. Again, the contracts, I think, will look very different depending on the organization. If it's a smaller organization, they may only have the capacity to do one. Maybe the evaluation is going to be a little bit tougher. So we'll focus, you know, maybe on our end a little more on that and take it a little bit more off of them. It'll really be dependent, though, on the organizations that we communicate with and who have interest. You know, we're not going to be forcing funding on folks who don't think they can handle this type of work.
Thank you. Colleen?
Well, I obviously think this is a great idea, especially given the number of people in the state that speak a language other than English and need resources. But I'm just wondering, is there any criteria for the bilingual person? So, you know, one of the things that we always struggle with is when agencies want to hire staff that are bilingual, but that person isn't certified or isn't an interpreter, doesn't have any qualifications, and you don't really know what their level of ability is in a language other than English. I mean, just because they're from a community and they may speak a language doesn't necessarily mean that they can be an effective interpreter for especially technical information that they're trying to convey to somebody who doesn't speak English at all or speaks very little English.
That's an absolutely wonderful comment. And, you know, that is something that, again, I think we're going to need to be working very closely with these community-based organizations to kind of come up with that eligibility criteria, as well as getting their recommendations for some community leaders whom they believe are adequate to do this. But I would certainly and then welcome feedback from folks on, you know, different experiences that you may have seen. So Colleen, if there are recommendations specifically that you have as far as you know, recruitment or retention, or
I mean, this is something that we struggle with because what we always tell, you know, so there's 59 area offices for the aging that NYSOFA oversees, and all of those offices have different communities, and many of them have large communities that speak a language other than English. And so they want to hire bilingual staff, which I think is wonderful. But when they're conveying information, especially like when it's health information or legal information, you really have to be careful that nothing is unintentionally conveyed incorrectly. And so what we always say to them is, you are taking the risk. If you choose not to use an interpretation service with certified interpreters and you choose to hire bilingual staff, you are taking the responsibility on, and you really need to make sure that you are comfortable with that person's expertise, because you're basically certifying that this person is capable to convey this information. And a lot of them, you know, that gives them pause, because now you're talking about, is there a waiver that's required? Does somebody sign something? Is there consent? You know, there's all these things around that. So I just think, and I don't know, Jackie, if this is like something you've already thought about and come up with some ideas for, but I just think that could be a stumbling block. I don't think it should stop the project, but I just think it's something that to give you pause and really think through how to make sure. I mean, like in the civil service system, there's titles and there's a test that you take, and there's a way to ensure that the person is able to convey the information accurately. And I don't necessarily know that there's anything like that in place when you're talking about smaller community organizations.
Yeah, I can speak to that a little bit. So I know, and it'll just be like a hypothetical. We're not necessarily working with this organization, but could and, may. But thinking about like the Chinese American Planning Council, where they have, they have staff basically that are trained on DD services and kind of every day, basically like what they're doing is really like taking OPWDD guidance or, information about DD services and really explaining it to the families that they serve through their special education program or their special needs program. So that's what I'm kind of thinking about is like staff at these multicultural agencies that are working within the DD system and basically like, because they're helping families work, through, get resources, get services, they have that kind of knowledge base, so because I know it can be a little bit different, and you're right with like the civil service process where you might be hiring someone just because they speak another language and not because they necessarily have a background in the field of, in the field, basically like of developmental disabilities or aging or, so I think in this case, basically like they have staff that are, at a lot of the multicultural agencies that are doing that work kind of day to day and are really familiar with DD systems. And, in some cases, I know we did a focus group in partnership with CETA for the Korean American community, and we had an interpreter show up and basically like they just didn't know the jargon. So it was like the executive director of CETA that stepped in and started interpreting because it was, she's like, the interpreter isn't doing a good enough job, So I think that's who we're thinking of is really like some of the staff at these multicultural agencies who are in that role of sharing information and kind of have a lot of experience with, taking complex DD resource services, information and sharing it with families.
Oh, there you go. As soon as I said that, it came on. Yeah, no, I think that's good. I really would be concerned that there's dialect differences. There's all kinds of things to think of. So I understand that they're already working in that field and they're already well-versed in information around developmental disabilities and service systems. But I just, when you're flowing funding through, I just think that it's really something to think about and document somehow.
I think that's a really good point, and that's something, we can build, like, think through that eligibility a bit and build in some additional,
Even if it's just like the agency certifying that they feel that this person is qualified, some sort of something that, attests to the person's qualifications in being bilingual, never mind the certification for what they're doing, but just that they're able to participate in both languages.
I think that those are wonderful points, Colleen. And I think, again, back to your point, Jackie, I think within the eligibility and the recruitment period, that's something we're going to want to pay close attention to, as well as your point, Colleen. Like, we're not going to be able to 100% monitor what that person's capable of. So we are going to need to put, I think, some onus on we are going to need to put, a good amount of onus on the community-based organizations to ensure that we are getting quality candidates to accurately depict the information and get it. And I know before we go to folks in the room, we have Katrina online who also has a comment or question. So Katrina, if you want to unmute yourself.
So my question is, where can people get access to housing navigators? Because oftentimes when people hear housing navigators, they don't know where to go to reach out to housing navigators.
Very good question, Trina. So yeah, if you know folks who are already interested in receiving housing navigation as a service, if you go onto the New York Housing Resource Center, and we can send this out after the meeting as well, onto their website, they have a list of certified housing navigators across the state. Not everybody who's taken the course is on there, but it's folks who have taken the course and who have shown interest and have kind of come back to the Alliance for further education on updates. They're going to be listed there along with their contact information in the region of the state that they support. I believe there's between 300 and 400 navigators currently across the state, including 5 master housing navigators in every OPWDD region in the state. So that would be the best starting spot to kind of finding a certified housing navigator to work with.
Thank you.
I understand that the training cannot be provided in a different language, but perhaps there's room to develop handouts or technical information, because as a person who's bilingual, translating technical things into different dialects, different people's origins can get really sort of complicated. So perhaps some handout, something that the person read and.
Yeah, that is part of the intent of this, is for the folks that are participating in the course to offer feedback on what core information would really be useful to start. Again, there's a lot of information that will eventually, would love to see available in different languages, but really identifying kind of like what are the core components that we need to be bringing back to our organizations, back to our communities. So absolutely, that will certainly be a part of this.
Eileen.
So it sounds like it could be multiple community-based organizations that could be awarded. But is the total amount 50,000 that were, regardless if it's one community-based organization or happens to be 4?
So that'll again depend on the conversations we have and the capacity and the interest. So 50,000, yeah, we can go up to 50,000. It could be multiple folks being trained through one organization. That could be spread out to 10 different organizations, all supporting one person. It really depends on those conversations that we have with folks in the interest, but the amount of that is available is up to 50,000.
Thanks.
Any other questions or comments? Sorry, David.
Eileen, you follow? I thought you were. Yeah,
I think
no worries, no worries.
Vincent, do you have a question or comment? Okay.
Excellent. All right, Jen, back to you.
I think we have,
Or we have
one
another-
second. We got
Just
one.
A really
sorry,
quick-
Allison.
A really quick note from OPWD. We absolutely support this work in housing navigation in terms of, the longer term funding and approach and our current HCBS waiver. Just want to acknowledge that the waiver or federal authority is not yet known. We're exploring and working internally to really explore that. So I don't want to create expectations that it is going to be in our HCBS waiver. It may be a different funding approach depending on negotiations with stakeholders and, community engagement.
Jackie.
Would this be statewide and how long was it to take?
You're asking if it would be statewide and how long? Okay, so yeah, that we are definitely looking to make it statewide. Again, that'll depend on the communities that are interested and the organizations that are interested. But we certainly want to make sure that the resources that we're giving out there reach diverse communities across the entire state. For the length, so the course is actually offered like on a typical academic schedule. There's a spring semester, a fall semester. So, it'll depend on how quick we can get it up and running with certain organizations. So we may be able to be as soon as next spring ready to have a few people take the course. For others, it may be next fall, or, if it takes a lot of pre-planning and work, it could be the following year. So we have some flexibility for the amount of time, but there is kind of a schedule where this course is offered, and we would probably, be building these contracts around those schedules.
Other comments, questions? Jen, over to you.
If there is no further discussion, is there someone that would take this to a vote that would be agreed that we begin the voting process?
I'll move it.
Vincent on the motion.
And is there someone who will second?
Colleen on the second.
Thank you.
Okay, let's bring this to a vote. All in favor? Any opposed? Any abstentions?
Stuart, you're abstaining. Thank you.
You're good. Okay. The Multicultural Housing Navigation Funding motion is approved. Jen?
So yeah, we're
Oh.
going to bring back the folks from recusals. So we'll just give it 1 minute.
Thank-
So it looks like we have the remote folks back, and I think Peter will be joining us in a second.
Okay.
Great. I'm just gonna chime in here for a minute because we are running a bit behind now. But I do want to hopefully have Jen do the conflict of interest training next. Then we'll take a really short break. And then hopefully before lunch, we'll be able to do our PPR presentation because both of those are required by our federal funder. We need approval on the PPR. So those are two necessary things that I want to try to get done this morning. So we'll have to see about the leadership reports. So we'll have to see how we can fit that in either this morning or maybe this afternoon. So that's the plan.
Sounds good. Jen?
Thanks, Dave. As Vicky mentioned, we're required by our federal funders to do an annual conflict of interest training. So what we're going to do is show a very short video that explains our conflict of interest policy. And then after the video, we'll offer an opportunity if anyone has questions.
So I'm going to bring up the video. We did test earlier. It should work fine, but folks who are remote, if you're not hearing anything, please just wave your hands frantically and we'll look to address. So thank you. As council members, you each play a crucial role in project development and funding. Because of this direct role, it is important that you understand the conflict of interest policy. What is a conflict of interest? Conflict of interest is when you have any financial or personal interest, direct or indirect, that would make it difficult for you to make decisions about our projects and funding, fairly or without being influenced by personal feelings. Some things that can impact your decisions include your employment, where you work, your source of income, money. Personal relationships, something that impacts your friends or family. And professional relationships, if you serve in a leadership position at an organization or serve on a council or advisory group. These can all potentially influence your decisions here. Take for instance the following example. Your family member is the director of an organization which has applied for a grant. You are interested in the grant, you would like to be a reviewer. Could you have a conflict of interest? Would you be able to make an unbiased selection? Would others think you would be able to make a fair decision? This is an example of a conflict of interest. Why? Because you might not be able to be unbiased and may unintentionally prefer the application of your family member's organization over other applications. Or others might think you would be unable to compare the different applications fairly. If you think that you have a conflict of interest, what should you do? The first step is to immediately notify the staff. Second, you should notify the committee or work group chair. Third, you must recuse yourself from the conversation. Recuse means removing yourself from the discussion and room because of a potential conflict of interest. Recusal is different from abstention. While recusal is removing yourself from all discussion, abstention is just formally declining to vote, either for or against a proposal or motion. People who abstain still participate in the conversation, stay in the room, and have access to information about the project. Why is recusal important? Because it helps to ensure conflict-free choices are being made and supports us to meet the state and federal government's ethical standards. At what points should you recuse?
You should recuse yourself at the following stages of the project development: work groups and concept papers, set-asides, RFP motions, level 2 reviews, and applicant funding motions. This should happen at the level of committee meetings, executive meetings, and full council meetings. What happens if you don't recuse? Consider another example. You are sitting on a work group which creates an RFP. Then you find out that your employer wants to apply for the grant. Can your employer receive the grant? The answer is no. Your employer cannot receive this grant because you did not recuse from the conversation and you have a conflict of interest. Why is it a problem that you didn't recuse? Because you could share information with your employer that other applicants do not have access to, which would give your employer an advantage in completing their application over others. If you have a conflict of interest and do not recuse, your employer would not be considered an eligible applicant. Not sure if you should recuse or not? When in doubt, always ask a staff person. It is better to check before the potential conflict of interest arises than to wait. What happens when you do recuse? Once you recuse yourself, you excuse yourself from council discussions, reviews, and votes concerning that project. You will also no longer receive information from the council or staff about that specific project during its development. This means that you will receive redacted copies of meeting minutes and packets, where all information about the project you have recused from is removed. Let's review. A conflict of interest is anything which could influence your decisions about projects and funding, such as your family or employer. If you have a conflict of interest, you should recuse yourself immediately. Recusal means you remove yourself from all conversations about a project and at all stages of its development. This helps ensure that our funding is distributed fairly and effectively. Still have questions about conflict of interest? Be sure to contact the staff with any questions or concerns you may have.
All right, so big thank you to our very own Drew Webster for being the voice talent on the video. I think the biggest takeaway is if you have the smallest question that you might have a potential conflict of interest, it's really important to ask a staff member. You can ask myself as the ethics officer or Jackie or Kim as leaders of the committees, and we'd be happy to help you with that. So at this point, I'd wanted to open it up if any council members had any questions about the conflict of interest policy. I do have a handful of our policy on hand if you'd like a paper copy. I'm also happy to email it to you. We are working on making the policy more accessible. So once that's finalized, I can share that with everyone. But if anybody has any questions at this point, I'm happy to answer them.
Jen, can I just mention there is at least one person remotely who could not see or hear the video. Is there anyone else remotely who did not have access to the video? If you just want to raise your hand. Okay, so there is one person and maybe we can send that separately.
Yep.
Okay, thank you.
Any questions? Okay, so all of you in the room have our conflict of interest attestation form. Yep.
Sorry, I do have a question.
Sure.
So when we're filling out this form, are we supposed, if you're an agency representative, are you supposed to put your agency under the organization or not? Because that's who you're representing.
You should put your agency under there.
Thank you.
Yep. So for those of you in the room, there's a copy of the attestation in your folders. You're welcome to fill it out today and hand that to me at some point during a break or the lunch period. For those of you that are virtual, you can email me a copy of the form. We are required to keep attestations for each of you on file, so we will be reaching out if we need that form.
I just want to jump in. We do need the form. So everybody in person today, please make sure you fill it out and we'll follow up with the people remotely. Thank you.
Yes. Thanks, Vicki. Okay. Thank you, everybody.
Thank you, Jen. We're going to take a break at this time, a 10-minute break. So please be back by around 10:40. Those of you who are online, you can stay logged into Zoom during the break. See you in a few minutes.
Yeah, it's 10:15.
Oh, yeah, I'm looking at the schedule. So 10 minutes break. That didn't help. So can we do 15 minutes for the leadership reports, you think?
We can try, Dave. Mine's real quick. Can you hear me, Dave?
Oh, it's a great idea. Yeah.
I'm sorry, Vicky, did you have a comment?
No, I was just saying to Dave, we can try. I mean, what I want to do next, I do want to do the PPR presentation, Dave. Can you hear me okay?
We'll relay it over to him, Vicky.
Yeah, because that, we do need to vote on that, and then we'll see if we can fit in the leadership reports. If not, we
So
can do it.
PPR first and then leadership.
Yep, yep.
Thank you.
We're going to do that immediately after the break. And then leadership comes next, or? Okay. So we're just switching them around. Yeah. I'm going to cut my leadership report down to about 3 minutes. So I think we'll be okay.
How you doing, Sean?
Your form all done? Perfect, thanks, John.
All right.
Pointed out the third funding session today. Stay at Mary Ellen. Gonna narrate the journey.
Okay. Yeah, that's where it's right?
Yeah, and Mary Ellen says the first one, and should I then?
I can't imagine.
It's funny because if she wasn't here, I wouldn't be. Yeah. Yeah.
Yeah, I think I
But.
Yeah.
All right.
Yes.
All right, everything's been going great, so thank you very much. Oh, yeah. Sure.
Yeah. We do have a few extra seats at the table, which is fine, maybe 3 more people, but yeah, yeah.
Hey. Where's Chief?
Yeah, that would be. Okay. See, they asked, I mean, I'm sure they must have residents, but I was like. Now.
I think we'll go ahead and get started. Get my stuff out of your way. That's yours.
Yeah.
So we are doing the reports now.
Yes.
Oh.
Jen's gonna do the PPR.
He's gonna do that right now. Okay,
And then we're gonna go into the leadership.
very good.
The PPR.
Okay.
Okay.
Very good.
Right after some major.
Yeah, so Dave, I have you want to mention the switch in the agenda.
Yeah. Okay. Welcome back. It was a brief break. Hopefully it was a good one. We're going to do a little switching in our agenda for today. We're going to actually put off the leadership reports for now. We're going to go right back into Jen Goldman's PPR update. But before we do that, it's my privilege to introduce to you our new Executive Director, Kristen Proud. Kristen, welcome.
Thank you very much. Good morning, everyone.
Like to say something.
Thank you very much. It's great to see everyone this morning. I have not officially joined the council quite yet. We're on the verge, another 10 days or so. But I did want to come and at least listen to as much of the meeting as I can stay for today while I continue to make my transition out of the Department of Health. I had the privilege last week, I guess it was just last week, of going to the NACDD Leadership Summit, which was a really great opportunity. I know a lot of you have interacted with various members and staff at NACDD, so it was a great opportunity to go and meet the people who will be my peers and colleagues in other states, and to hear about some of the issues that other states are facing. Thankfully, some of those issues we are not facing here. I was telling a couple of the staff over the last couple of days that there were a lot of discussions about guardianship, and in one of the states, they're on the opposite end of the spectrum from where we are. And thankfully, we are where we are, thanks to the good work of the council and the pilot project and the change in statute. And in one of the states, their legislature is contemplating mandatory guardianship at 18. So it just was an interesting opportunity for me to see just how varied the approaches are in different states. And although we have obviously a tremendous amount of work always to do here in New York, I think that we are in many ways in a better position than some of the other states on a number of issues. So a lot of that's due to your input, your efforts over the many years that you have served as members or staff on the council. And I thank you for all that work and look forward to continuing it with you.
Thank you, Chris. Jen Goldman is going to do our PPR update right now. There will be a vote required after she's finished. Jen, please.
Thank you, Dave. So once again, we have something that's required by our federal funders each year. So we have to submit what's called a program performance report. You'll hear us refer to it as a PPR. So this is our annual report that we submit to the Administration for Community Living. It includes project updates and outline where we are in our progress towards meeting our state plan goals and objectives. Also, how we are doing on tracking and meeting our goals for our federal indicators, our measurements that we use to determine how well our grants are performing. It also includes updates on staff activities as well as financial updates, which Jesse will be covering under his leadership report portion of the day. So I'm going to provide an overview of a summary of how we've done over the year, and also a summary of our staff activities. Jackie and Kim are then going to provide several project highlights from each of their committees, and then at that point, we'll ask for a vote. Okay, just as a reminder, this is the state plan that we're currently operating in. We just finished our second year of the state plan, federal fiscal year 2023, and we're operating under the three major goals of people with developmental disabilities, family members and caregivers, and then systems change. And as I'm sure you're all familiar with by now, we have several objectives under each of those goals. And this is really our contract with ACL and also our roadmap that we follow and fund all of our projects through. So what is the PPR? I touched on this a little bit already, but this summarizes the work that we've done over the federal fiscal year, outlines our spending, and then also provides an update on our state progress. The PPR is due for the previous year is due at the end of the calendar year, December 30th. I always like to try to work extra hard to have it done before the holidays so we can all have a peaceful holiday. So again, this is just a document that outlines our progress over the year. This is just a quick snapshot of all the grants that we've done or continued through this fiscal year. The grants that you see highlighted there are grants that were new to this federal fiscal year. Some of them should look quite familiar to you. I know Jackie and Kim have worked very hard with their committees to pass these funding motions for these projects, and I think you're going to summarize some of them in your presentations. Okay, so this slide just gives a snapshot of the outreach of our grants for this current federal fiscal year. This is for quarters 1 through 3. Quarter 4, the reports are due at the end of this month. So we haven't received all the grantee reports, and we're still crunching numbers for the 4th quarter. But I do think this gives a very good indicator of the breadth of our outreach from all our grants. So in total, we had reached over 17,000 people with our grants, and you'll see there the breakdown between people with developmental disabilities, family members and caregivers, and then others, which would include direct support professionals, other types of stakeholders from other organizations, and other people that have participated in our events. So this does not include the small grants that we issue, but I still think it gives quite a good snapshot. I looked at the numbers from last year from our 2022 PPR, and these numbers are pretty in line with what we did last year. At this point last year, we had over 16,900 people total, so we've made a little progress there. And for the most part, the percentage and the breakdown lines up. Last year, we had 20% people with developmental disabilities, 32% family members, and then 48% others. I think the slight discrepancy in percentages really relates to the type of projects and the projects that we were doing between last year and this year. Okay. Again, this is a quick snapshot of our outcomes for this year, again, based on quarters 1 through 3. As I mentioned in the beginning, we're required to report on various indicators and measurements of the performance of our grants. But I really wanted to give you a highlight of the indicators that I think are especially important and demonstrates the successes of our grants. So 93 people with developmental disabilities and 89% of family members reported that they were satisfied with their participation in our grants. 76% of people with developmental disabilities and 62% of family members who filled out, I should say this is of the people that filled out surveys, reported increased advocacy efforts after our participation in our grants, which is one thing that we really hold dear, and a required measurement of the federal government as well. And also equally important, and I'm really proud to say that over 580 people reported being able to better say what they wanted or what was important to them. Again, this is just a couple of the federal indicators that we need to report on. If you're interested in learning more about the other indicators, I'm happy to share that with you. But again, this is just, ones that I think were really more demonstrated more the impact of our grants. Okay. As I mentioned at the beginning, in addition to reporting on the outcomes of our grants, we also have the opportunity to report on initiatives led and activities led by staff. So you'll see there just a quick overview of the activities that staff have engaged in over the course of the year. We've done various presentations and participate in various state and national events. We've, especially Jackie and Kim, have led and participated in various communities of practice, focusing on various issues. And As all of you are aware, we've developed the documentary, The Path Forward, Remembering Willowbrook, and we continue to work especially hard to promote that, the documentary, and share that with as wide of an audience as possible. Also, I will mention that we recently looked at, we have an online survey that we share with all the participants that view the documentary, and we took a quick peek at the results so far of that survey, and the feedback has just been wonderful and overwhelmingly positive. We recently in September had our New York State Advocacy Institute, which was also a smashing success. I was very proud of the work that we did with that. We also partnered with the ARC New York and the New York Alliance to launch this initiative. It was the first one we've done, and I think, and I do hope that we will continue to partner with the ARC and the Alliance to offer this on an annual basis. And also, we have, thanks to Jackie's leadership, we've developed a DEIA strategic plan that I know I don't think today we'll be doing updates, but she'll be updating in the future. And we're really proud of that because we are really trailblazers with that, and one of the first councils in the nation to have such a plan. Okay, now I'm going to turn it over to Jackie and Kim to give you some highlights of some of our specific grants under each of the committees.
Thanks so much, Jen. All right, so as I think folks who've been on the council recall, each year we kind of try to highlight a few of the grants and just give you some snapshots as far as the work to date. So the first one that I'm going to talk about is our grant with the Office for the Prevention of Domestic Violence. So as folks will recall, this grant is really focused on building capacity for both developmental disability and domestic violence providers. So, and I think everyone on the council is aware at this point that the rates of violence and abuse against people with disabilities are quite staggering. And so the goal of this grant is really to make sure that both systems have the capacity to respond when there are concerns about domestic violence and abuse. So OPDV thus far has offered several learning exchanges. So our program lead at OPDV has gone throughout the state to various developmental disability as well as domestic violence providers to hear about what the concerns are, hear about what the issues are, and really understand where the field is at. And all of this information that she's collecting is going to inform the training. So that's the goal for this upcoming year. This grant actually starts on the calendar year. So January 1, we'll be going into year 3 of the grant. And so in year 3 is when OPDV is going to open up a competitive request for proposals for a subcontractor to actually develop the trainings. There may be 2 subcontractors on this because they need both the domestic violence and the developmental disability expertise. So these learning exchanges have helped inform that. And then we're going to develop the training curriculum and implement the training in the last 2 quarters of the upcoming year, and then in the following year as well. So I think one of the important lessons learned thus far from the training or from the learning exchanges, is that there's apprehension on both sides or within both systems. So the developmental disability system is, they're aware about the abuse, but don't quite know how to handle it. So there's definitely a need for kind of skill building there and training staff on how to respond and who to go to. And then for the domestic violence system, obviously, responding to domestic violence and crises is what the system is designed to do. There's a lack of awareness or kind of apprehension around developmental disability. And so there's a different type of learning and capacity building that has to happen on that side. So the training will be developed, but really there's going to be kind of 2 tracks that are system specific. So more to come on that, but we're excited about the work they've done. Kelly, who's our contact at OPDV, as I said, has been all over the state, especially over the summer and fall. And so she's just been building a great network, and there's a lot of support, and we're excited to see the next steps. Any questions on this project? All right, not seeing any, we can go to the next. So the next grant is our entrepreneurship grant with SUNY Farmingdale. So folks will recall the purpose of this grant is really to offer training for people with developmental disabilities who are interested in starting their own businesses. And this, we're kind of defining starting your own business broadly. So that could be a fully kind of sustaining business, or it could be kind of a side business as well. So the scale is all about relative to what the person is interested in and what they envision they would like to do. So SUNY Farmingdale really hit the ground running. This grant started at the beginning of 2023. So they've only been operational for a little over 10 months, but as I said, really started and went for it. So back in the spring, they offered 10 sessions of Is Entrepreneurship Right for You? So this is kind of a way to dip your toe in and understand, is this something I want to pursue? Maybe someone has some ideas about a small business that they would want to start. So it really helps to answer some of those initial questions that a person might have. And then over the summer and into the fall, they've offered this more in-depth series called Starting Your Business, What You Need to Know. So there's kind of four webinars that are a part of that series, including best business practices, writing a business plan, marketing and analytics, and then financial planning. So it really gets into the more nuts and bolts. And they had 30 people complete that entire series, which is actually, I think that's quite notable. So very good. They had additional people who maybe attended one session or two sessions, but they had 30 people who attended all four and obtained a certificate at the end of that. So in addition to these courses, they're working with 10 small business development centers throughout the state, and these are all housed at universities. So as part of the grant and with the relationship with the small business development centers, anyone who is interested in working with a small business development counselor can interface with them and get one-on-one support. So far, 19 people have worked with the SBDCs is the acronym, and are receiving one-on-one support to take those next steps to start their own business. So it's very exciting for year one. Those outcomes are really phenomenal. So this is a 3-year grant. So we have a couple more years, and I'm excited to see what they do in the subsequent years. Any questions? Yep, I'll go to Shamika first and then Kristen next.
I don't have a question. I guess I don't know. I missed the connection between the DDPC and these classes, because I've actually taken some of these classes, and I guess I didn't. I guess I missed that it was one of our grants. That's all I was saying. I enjoyed the classes very much. So that's what I was going to say.
Well, it sounds like we need to work with them too. These are just the screenshots are actually the flyers, and I believe they do have our logo on it, but it sounds like we need to work with them to publicize a little bit more. No, a good conversation to have with them. So thank you for bringing that up, Shamika. Kristen?
Thank you. Shamika, perhaps you can give a testimonial so that we can, use your experience to help promote it more. Kim, I just want to ask, of the 38 who got the certificate and the 19 who work with the small business development counselors, are they, I hesitate to use the word tracking because that sounds so big brotherish, but are they following up with those individuals to both see if they are actually pursuing starting a small business, or if there's other support or technical assistance that could be provided through this grant to help them with whatever the hurdles might be to go to that next step and actually start something?
Yes, absolutely. So that's part of the grant, is to kind of keep up with the people who are participating, under the guise of our grant, and see what's going on and see how many people for whom starting a business kind of comes to fruition, or they're taking those next steps. I will say one of the challenges that they've already seen, and this is going to be no surprise to anybody in the room, but is benefits management. So people are always concerned about benefits and the potential loss of benefits. So they've been working with some of the SBDCs, small business development centers, do have benefits management folks on staff, but some don't. And so trying to link the individual up with a benefits coordinator has been one of the things that they've been doing. But yes, absolutely. And so they just wrapped up their third quarter. So, you know, I think especially for the people who do choose to pursue this, because we know that there is going to be some attrition. Some people are not going to choose to pursue that path, but there will be follow-up. And so we'll be getting some of that data in the subsequent quarters. And then in addition, we'll be, you know, we do our site visits with them so we can learn a little bit more about individual stories as well.
Thanks. It's great that they'll be doing sort of outcome measures. It'll also be interesting if they're keeping track of what people who are not pursuing it ultimately are saying about the reasons they're not. And there are obviously a whole host of reasons. Some of them are personal reasons, benefits, as you mentioned. But if there are certain patterns emerging from that information about why people are choosing not to move forward, then maybe there are some hurdles that can be overcome in trying to make it easier for individuals to start if they still want to do it. Great.
Yeah, absolutely.
That's
Thank you.
exciting.
Kim, we have 2 questions from our remote participants,
Okay.
Josh, Christiana, and then Ben.
Sure, thank you. I think Shamika maybe had beat me to the question here, but I guess Kim, just you know, as this is being talked about, I just wonder how they're going to handle maybe advertising, marketing it, getting it out there further than the small business development centers, because I don't think I had a great awareness of this really. But it sounds like a great opportunity, and maybe they're just trying to manage the, you know, participation size initially. But, you know, I think more information on how they are going to actually get that information out, because the first round here sounds like it happened, but wasn't a lot of awareness of it.
Yeah, that's a good point. And I think this is a struggle that a lot of our grantees face, honestly. So I know that they have their networks that they push everything out through. We also support our grantees to push everything out on our social media and our listserv. And I know that we've done that with these guys, but potentially, you know, I think something that has worked in the past, Josh, has like you guys obviously have the statewide network. So we'll forward you information sometimes to push stuff out. So I think we can try to be a little bit more targeted rather than only using CDD's social media. We can put things out. Yeah, it's 10 years of undoing in my brain. We can be a little bit more targeted to support them. Because certainly, I mean, like I said, there's 10 SBDCs, small business development centers, I have to say it out loud, throughout the state. And so, you know, this isn't, although SUNY Farmingdale is our grantee, it's open to anybody and everybody in New York. And so we certainly want people to be aware. So I think, you know, both your points are great, that we need to be a little bit more targeted and make sure that more people are learning about this.
And then we had a question from Ben.
Yeah, so Kim, so I believe this is a webinar based. Are they going to publish this one as available to the public, like everybody can learning and see what's going on?
Yeah, so these, yep, they are webinar based. They are open to everybody. So the registration, they do it through, I don't know, Kira, do you remember, is it SurveyMonkey or Eventbrite or something like that, I believe?
Yes, I think that's
Eventbrite.
correct.
Okay. Yeah, but it is open to everybody. So yeah, I don't know, Ben, if you're looking for specific information to push out to your community or.
Yeah, so I just want to see, like, you know, if we did not register, maybe we can review the class, maybe somebody.
Oh, like seeing a recording or something after
Yeah,
the fact. Yeah, we'll have to ask about that. I will say they do run the sessions regularly, so it's not like if you weren't able to attend this first time that you're kind of out of luck. They do run them regularly and they offer it at various times, but we'll get in touch with them and see if they have recordings that you can view after the fact. And then just an additional note, the SBDCs, that counseling happens remotely and in person. So if a person wanted to actually go to the Small Business Development Center that's participating in their area, they could go in person or they could do it virtually. So there are some options there for folks.
Okay, thank you.
Sue?
Yeah, quick question. Shamika made me think, do we in our contracts require or ask that grant recipients credit the CDD money in any written things? Because, the fact that it's not on there,
Yeah, it is. Our logo is on here. Like I said,
Okay.
these are just screenshots. So I just took I didn't do the whole thing because it would have taken too much space. I know our logo is on here, but we do require that. It's in our contract and in the work plan. And then in addition, so that's for like flyers, they would put our logo, or like a pamphlet would be our logo, but actually for more extensive, if there's a training curriculum, there's actually a whole paragraph that they have to put on there. So yes, it is required.
Kim, can I just also mention as far as registering for some of these workshops, if you received our recent newsletter, which just came out, we actually have a button, a link right in there that you could register for. It's a little bit about the entrepreneurship program and also a registration link. So if you're interested, take a look at that.
Thanks, Gina. All right, I think we're good on that one. And then we'll go to the last one for the IFC. All right, so the third project I'm going to speak about is our nurse training program with the University of Rochester, one of our USAID partners. So this grant also just began January 1 of 2023, so it's brand new. This is a 5-year grant, and the goal is to train emergency department nursing staff primarily, although there is going to be some kind of trickle down to other staff as well on how to work with people with developmental disabilities. We know that care tends to be subpar for people with developmental disabilities. People have good intentions, but, may not understand the complexities, may not understand behaviors. There may be communication barriers. So University of Rochester is developing an in-depth and comprehensive training. So in year 1, they have done a lot of the outreach to inform the curriculum. So they've been doing focus groups, they've been doing interviews, they've been doing surveying of nursing staff, as well as people with developmental disabilities and their families to understand kind of what's going on, what are the barriers to care, and what isn't working and what is working. I mean, it's not only negative, but also trying to kind of highlight the positive things that are happening. So that was about the first, 6 to 9 months of the grant. They have now written all of the narrative for the trainings. They've also recorded interviews and videos of people sharing their experiences, and really folks speaking very candidly about their own experiences receiving care in hospitals, and in many cases reluctance to go obtain care until things are kind of at an emergency level because of past negative experiences. So very very emotional material that is going to be used to inform the trainings. So the trainings are now under development. They feel like they've collected enough data at this point to create the content. They're in content creation now, and they will be implementing the trainings starting next year. So starting in 2024. Again, this grant is going to be hugely impactful for the hospital system. And in addition to training U of R staff, in the contract, the University of Rochester is meant to work with 10 other hospitals. They've already been kind of creating that network and garnering interest from hospitals, including hospitals in other parts of the state. We had a call with this team last week, actually, and Susanna had mentioned that they already have buy-in from a hospital in a more rural area of the state that is very under-resourced. So it's also trying to work with other hospitals that may be in different different statuses, and making sure that this care is going to be available, better care is going to be available to anyone with a developmental disability, regardless of where you are in the state. So very exciting. And again, I've said this with all of them, but more to come, and we're excited to offer updates as these projects get further along. Questions? Oh, yep, Kristen.
Given I'm coming from the health department, I'm super excited about this one. And I do, when I meet with the hospitals, which is often with the hospital leadership and medical school deans, et cetera, talk about this a lot. And I'm wondering how University of Rochester is selecting the 10 that they're going to partner with, because we can certainly hook them up with the hospital associations to try to get a good array of hospitals representing, as you said, small, large, rural, more urban, et cetera. But I'm also wondering if there's a way, or if there's something in the contract after they get underway to be able to share the training curriculum or train the trainer type model, so that other hospitals, even if they're not part of the initial group of 10, could still benefit from the materials that are being developed, and then train their own staff in-house to be able to push the curriculum from the trainings to whether it's ED staff or even other staff in other med surg units or other parts of the hospitals.
Yeah, so let me focus on one at a time. So Haney's, the Hospital Association of New York State, yes. So they have been working with them to identify other hospitals. But certainly I'm sure they would welcome, additional support in, I think right now, from what I understand, is kind of working with the willing, working with those who say they have the capacity and are interested. But, I think more support in that area is going to be welcome. And then it is a train the trainer model. So that would be the ideal to be able to expand. And they're doing, what's the word I'm looking for? Like virtual learning or online learning. They're making it accessible so that, any entity would be able to access the training online. There was a third thing I was going to say, and it's escaping me at this point. Yeah, I don't remember. Did that?
Kimberly,
Okay.
Sorry, can I add to that?
Yes, Susanna, go please.
Yes, so we're leveraging existing networks. So Haney's is definitely one. The AUCD network is another. We're actually we have a QR code like interest survey basically that hospitals can use to identify interest, and the PI of the project, Amanda Leprime, has a lot of these connections. So I think that's important, but I also want to make it clear that it's not specific to emergency departments. It's also inpatient units, adult and pediatric. So med surg, CPEP, like all of that is included. And we had conversations with nursing leadership within the last month to ask that they make this mandatory training on those units. And we have a rollout for pre-test evaluation planning meeting next week. And I believe we're targeting 28 units, I think was the initial commitment from the University of Rochester. And I also raised my hand because I just wanted to make it clear for the group that part of this grant, we also do have key personnel with disabilities on our planning team. So I wanted that to be very clear to everyone. Thanks.
Yeah, and I was just going to add too, thank you for that, Susanna. That's very helpful. That the 5 modules of the training have been identified. So it's medical comorbidities, mental health, attitudes and barriers to care, adapted nursing care environment, and managing medical and behavioral crises. So those are going to be the topics that are covered through the training.
Kim Bin has a question.
Mm-hmm.
Yes, so this project is really hit my heart because we have family member with terrible experience when send their children with autism to ER. So we know it's an issue for everybody. I'm also working with one of the research from Washington that we try to collect the story about the family member experience, the ER experience, and particularly we try to find out is any way somewhere in the emergency room hospital, they violate the rights for the people with disability, especially for the autism, because certainly from the personal experience or the family story, we see that lots of the accommodation, they did not be recognized, or the hospital even did not realize they are against the law or violated the rights of this one. So I'm wondering if this project also exam on that part, examine the emergency room, the procedures, everything, does they consider people with IDD? Does they consider the needs of the special, especially for people on autism? So this is my question here. Thank you.
Yeah, so it sounds like, Ben, you're asking about if the project is also paying attention to where people's rights are being violated.
Yeah.
Yeah, and Susanna, I'm going to throw it over to you. I don't know that that certainly wasn't a specific focus. Susanna, I don't know if that's come up in any of the data collection that you guys have done thus far, or if that's kind of been recorded in any of that data. Do you have any thoughts on that?
Have a lot of thoughts on that.
Okay.
Ben, thank you so much for that question, right? So it's not a question that we specifically put into like a survey, right? Because it's really loaded and the hospital has to approve what goes out to nurses, right? And patients. However, one of the reasons that we thought it was so important, to include people with disabilities and key personnel is because that was one of the first things they said, right? They come to our meetings and they say, these are the very real issues that we're experiencing in the ED and on inpatient units. Then we can work that into the interview guides that we used in the qualitative phase. So we have a ton of qualitative data, and many of these are professionally recorded videos that were done to integrate into the content. All of the modules include at maximum half didactic, and the other half is actually hearing from people with disabilities and family advocates and nurses about their very real lived experiences on the units and in the ED, right? To make it real, to like make it a true connection and humanize what's actually happening to people in these settings. And you are 100% correct. So many of the stories are explicit examples of injustice that have been leveraged against disabled patients in our hospital. So the answer is yes, it's very disturbing. It is one of the reasons that we felt that having a separate module on attitudes and bias and the undervalue and the disvalue for disabled lives was important to include as part of the mandatory training. So that will be reflected. We have to balance it also, right, with like understanding that this is information that's going to nurses and hospitals. And so we have to focus on, we acknowledge this and what are the next steps to help address some of these biases. And we also have to recognize that there are systemic and infrastructure related barriers that a lot of time nurses want to do more and they want adaptive equipment and they want more training, but they're not working in a system that's providing it for them. So we have to kind of acknowledge that at the individual level, we're encountering biases, and then we're also at the organizational level encountering systemic bias and oppression that's perpetuating these cycles. I hope that answers your question.
Yeah, that's great. I really hope that the project is a success, and I really want the project to every hospital, every nurse, every emergency room here, because this is really important. Thank you very much, Sam.
Kim, we have a question from Josh Christiana, but first Katrina has noted in the chat, can compassion be added to the topics?
Yeah, and that is, and Susanna, you can correct me if I'm wrong, but that is built into the which module is it?
It's actually so compassion is included in all of them, right? Like compassion needs to happen across all of these settings, and that's one of the things that we heard right directly from our advocates is that they aren't viewed as people, and they aren't in the hospital, and they aren't treated with value and trust for their own like expertise and their own experience in medical care. And that oftentimes that comes with like a feeling of depersonalization or dehumanization. So it's important to talk about compassion, not just in the context of attitudes. Like, yes, that's what attitudes is about, but the idea of compassion and validation and trust in your patients needs to be woven in throughout all of the topics. So it's included in all modules, and it's also balanced with compassion for nurses about the experiences that they have day to day working on the units, and the fact that like nursing care is not a good place to be right now. So I'm so glad you brought up that point. We think it's critical for patient-centered care, and it is included, yes.
And we have a question from Josh.
Sure, thank you. So first of all, I credit to you all to putting together this program. I think it's much needed. As I'm looking at this, I'm seeing that, the model is based on training, led by, as it notes here, medical and behavioral providers. But I'm curious if that is considering the relationship of a service provider to a person with intellectual and developmental disabilities and their role in, referring someone out to a hospital, helping support them, when they're coming through the intake process, even when they're admitted to a hospital. There's a relationship that goes on between the provider and the hospital itself. And that's something we've experienced as a provider community as a challenge at times, which is, you know, the the understanding of the roles of the provider in the process, both pre, during, and post care. So is that somehow built into this content? Has it been considered? And if it hasn't, I would really encourage that that has to somehow be worked in.
Yeah, thanks, Josh. I mean, it's such a good point. And I think you're raising the issue of like, there are disciplines beyond nursing for whom this is critical, right? Like the outpatient access specialist has been brought up, intake, triage, phlebotomy, social work, child life, like all of these groups have come to us and said like, well, what about us? Like, this is focused on nurses. Like, when are we going to get this training too? Right. So like, we have to balance, like, this is something that we're developing from scratch, and we need to demonstrate proof of concept, and we need to demonstrate efficacy, and we need to show that it works. So that's what we're focusing on right now within kind of like the confines of the population identified, which is the nursing group. As part of, I think, like we've discussed in years 4 and 5, as we think about scale up, dissemination, long-term implementation, and sustainability, that's when it's like, okay, how do we kind of tweak this a little bit to be relevant beyond the nursing discipline, right? Because you're right, the hospital is a system, like it's a whole family unit. And just like family systems are going to support individuals in their family, like hospital systems are all responsible and accountable to patient care. So it's definitely something that we want to work on. I think that what we're finding is that the content itself, there's aspects of it that's nursing specific. There's a lot of it that's not nursing specific. So I think that we're developing a manualized program that can easily be adapted for the context of other disciplines. And when we get to that point, we would love input with our partners on how to make that as successful and meaningful as possible. So if I didn't answer your question, let me know. I hope I did.
No, I can see the path forward. I'll just close my thoughts on this with, you know, I come from a service provider background as far as, you know, supports and services such as residential day programming. You know, we have nursing, and we deal a lot with the hospital system. And, you know, so I'm looking at it from the perspective of, is there a bridge that can be built in this curriculum to help build that relationship between the literal residential service provider and the hospital nursing staff to improve the relationship, make the experience better for the person who's going there. Because again, that is something we've experienced as a bit of a challenge over the years.
I think that when we're ready for that, you're going to be hearing from us. If that's okay.
Oh, we would love to partner with you on this. This is such a huge opportunity for the field.
Amazing. Thank you.
Yeah, and I'll just add to that too. Thank you, Susanna, for jumping in there. But, you know, I think folks who have been on the council long enough also know that, you know, we're learning from all of our projects, right? And potentially there could be a phase 2 as a part of this project. If there needs to be expansion, if we're identifying these other groups that would benefit from this training, there is a potential to do a phase 2 or kind of a different but related project. So as more lessons are learned, we can kind of keep that on the horizon and potentially do some subsequent projects that would address some of these specific issues that Josh has brought up and others have raised. All right, I think that's it from me. So I'll pass it over to Jackie.
Great, thanks so much. So I'm going to highlight a few grants from the Community and Systems Change Committee. The first one that I want to highlight is called Ensuring Access, and it was a grant with the Office for People with Developmental Disabilities. And it was a 2-year grant that is just wrapping up right now. And a little bit of background about this was that, you know, I think as many know, our agency has been involved in a community of practice around cultural and linguistic competence for the last 6 years. And we also have a standing cultural competency work group that meets 3 times a year. And some of the input that we've consistently gotten from families and self-advocates who speak other languages was about some barriers at the front door, and basically accessing that initial information around, you know, and securing eligibility for services. So there being a stumbling block. So we partnered with OPWDD for the grant. And I do want to say that while the grant was with OPWDD, all of the money actually went to an MWBE, or a minority and women-owned business. and who did the project management, and then two multicultural agencies, Synergia and the Chinese American Planning Council. And really what has happened over the last 2 years is they've pulled together focus groups from two communities. So the Spanish speaking community, Synergia, was able to help with that, to review front door materials, front door sessions. And then the Chinese American Planning Council was the other community partner. And so they reviewed it, and both groups met to look at and really identify what were some of the issues or barriers for front door sessions, front door materials. And a couple of things that they highlighted in terms of recommendations was having the front door. They said, you know, the front door session can be a little bit overwhelming. It's a lot of information coming at you, and breaking that down into smaller sessions, into smaller information bites will make it a lot more accessible and digestible. Having those, you know, breaking it down into modules and then having those available in other languages, so Spanish and Mandarin, as well as, you know, having closed captioning and ensuring that those modules are ADA compliant, are really important. So that was some of the recommendations that came out, as well as you know, one of the recommendations as well was just about they shared that in going to OPWD's website or looking at some of the materials, they don't always see people that look like them or that reflect their community. So a couple of family members shared that when they first went to OPWD's website, they thought, this isn't for me. So as a result of that input, basically the outcomes are that OPWD has created 30 front door modules total. And so each front door session is, you know, that's broken into 10 modules in English, Spanish, Mandarin, and with closed captioning and ADA compliance. And then the Chinese American Planning Council and some staff from Synergia, as well as families, provided voiceovers and reviewed the scripts for cultural and linguistic competency as well. And then, you know, also helped to do a photo shoot so that some of the community members would be represented on OPWD's website. And you'll see, you know, you could go to OPWD's website right now and see some of those pictures from community members who are now on some of the banners, which I think is really important to see that representation. And one of the things that I'll also say that I think was really important is really this approach was what was new and being piloted, was really partnering with community-based organizations to get that level of input, not just translating materials. You know, I think a lot of agencies will just translate, but not having that engagement of the community to really review, you know, the content, the format, the language, you know, the quality of the translation. So that being a more comprehensive approach to really making materials more culturally and linguistically competent. And then, you know, one of the other kind of positive outcomes that we wanted to highlight was OPWDD did decide to continue to fund the end products of this. So an additional investment is being made by OPWDD to sustain and enhance the project. And in, you know, conversations that we've had with OPWDD, they've shared that this could be a potential model for really expanding this kind of approach to other languages and other linguistic communities. So we're really excited about and wanted to share, you know, the outcomes of this project, which is really coming to an end and was, you know, funded with CDD funding. Any questions?
Are
Jackie,
the modules, oh, I'm sorry, go ahead.
No, go ahead, Jennifer.
Are the modules available to all of us? Like if we go on to the OPWDD website, can we see those?
The modules will be made available to everyone because they're in English as well. And I don't know if Allison, if you have any additional information, but that's my understanding.
Yep, I think we're still pulling that together and I can follow up in terms of timeline, but I think great work and the partnership has been fantastic. So we're excited to continue efforts.
Thank you.
Thank you, Jen.
Colleen?
Just following up on what whoever just spoke was saying about the modules being available. The fourth bullet down there about things being accessible and how to test for that would be very helpful to other people who may not necessarily know how to do that, particularly state agency people who haven't had any training in that.
Ben?
Yes, so I'm just have a general comments. I would want to show you how I'm proud that DDPC or CDD is leading the efforts to DIA. I give you the example from the other side you probably never heard about. First one of the example is like my son's picture is on the OPWDD, the website, because they coming to the getting picture from the Chinese community. So we have lots of our friends. It's the first time we have a professional photographer get a very good shot. I keep it very good. Well, but this is only one side. We not only see it make change. For example, OPWD hire bilingual front door coordinator in Chinese, but also have everywhere locally community group. Now they coming to me said, hey, can we do something for your Chinese community? Because we saw that Chinese community and the Spanish community list as underserved community from OPWD. Say, hey, let's do that. I say, I can speak Chinese, you can speak English, you get lots of experience, lots of good story that we can do together. So this is leading the leadership from DDPC or ICDD is bring the changes. And we starting to see lots of parents right now want to join the advocacy. Last time we showed the Willbrook one and the people just crying all the daytime there because they never know that this happened in history, and it could happen again if we did not do advocacy. So we got one of the parents right now join the OPWDD DDAC council right now. We get more and more parents want to join the school council. Lots of special the school district council. This is great. This is a great one. So I just want to see that it is we credit on the leadership from many years ago, maybe starting for this DIA. And I can see my community, my circle of friends, my family members, and other community members make a change. It really works. Thank you very much for that.
Thank you, Ben. Any other comments or questions? If not, Jen, would you lead us in a vote, please? Jackie,
Okay.
did you have?
Oh, we've got a couple more, sorry,
where's-
projects to, how are we doing on
Jack,
time? I
maybe
can
you
go
can
fast.
just quickly highlight, I was gonna say,
Okay.
we're running into lunch
Okay.
now. This has been great.
Okay.
All these questions. I love how engaged everybody is, but I know you want to get to lunch too. Go ahead, Jack.
Okay, I'll be fast. But I will say, if you have questions about any of our projects, please follow up with me afterwards. I'm more than happy, to provide more information. So just two more grants that I want to highlight. The first one is with the National Alliance for Direct Support Professionals. We piloted with them, really, they have done the work, training for staff in the field to better support people with disabilities who identify as LGBTQIA. And one of the really exciting things, first, I think, is just that the website Proud and Supported has become such a good resource and has a lot of materials on it. So just the terms LGBTQ in plain language in an accessible format can be found there as a resource. That's certainly something that we get requested a lot, just on some plain language definitions of LGBTQ. But there's also other resources there. So here's a list of the trainings that they've done in 2023. They did a number this year and usually maxed out in terms of registration. And so that's really exciting. And I wanted to highlight too, that picture on the left is they presented in partnership with our national association, so NACDD, to a national audience to share about the work that's being done in New York. Because I think in many ways, we have been a leader around, a number of issues, as Kristen mentioned at the, earlier. And this is one where I think other states are definitely looking to see what is being done. And so really exciting to see this training. We're in the final year, but I think, we're going to continue to think about what we can do in this area to better support people with disabilities who identify as LGBTQIA. And you can go to the next slide. Unless anybody can. All right, and then the final grant I wanted to highlight, really excited about this. This really came out of actually COVID. And so some of the concerns that were raised during COVID was just a number of self-advocates or people with developmental disabilities as things shifted online, really feeling left out. And there being some really significant concerns around the digital divide for people with developmental disabilities. So one of the small grants that we funded during COVID and continued to, we extended that grant into this year was the SANES Technology Me grant. And basically what they've done is create a series of videos and resources on how people with developmental disabilities can join online meetings. And I think they have every type of platform that you could join. And the trainings are written by self-advocates, delivered by self-advocates. You can see a snapshot there of one of the videos and that they've added too on virtual self-advocacy. So also advocating in a virtual setting, which I think is really important. Some of the additional things that they've done this year is really also, part of it was creating those resources and delivering trainings so that people with developmental disabilities felt, they had more capacity to join online, to participate online in self-advocacy activities. But part of it too is also advocating for people with disabilities to be included in things that are being developed to address digital equity. So people may know that New York State is in the process of developing, we received a lot of federal dollars, and the Connect All office and the New York State Public Libraries are developing New York State's digital equity plan, and people with developmental disabilities are included among the un- and underserved communities. And so we really wanted to make sure, in partnership with SANES, that people with developmental disabilities were at town halls really informing the development of this plan, because it comes with the spending of federal dollars. So we helped to co-facilitate with SANES and the staff who are working on the Technology Me project, a town hall on digital equity, and that will inform New York State's digital equity plan. So really excited about that. There was really good turnout to that town hall, and that really was because of SANES Network and their ability to get people with developmental disabilities to come and participate in town halls and advocacy sessions on New York State's digital equity plan. So any question? That's it.
Thank you, Jackie, and I apologize for interrupting you. I thought you were finished. Other questions, comments? If not, Jen, would you take us to a vote, please?
Yes, who will make a motion to move to a vote?
So moved.
Vincent on the motion, and I see Josh Cristiano is already on the second.
Wonderful, thank you.
Thank you. All in favor indicate by a raised hand. Opposed by the same sign? Any abstentions? Okay, the PPR update is approved, and it's time for lunch. Let's. Come on. Yeah, motion.
Can you use this in just a moment?
Yeah, sure. So we do need to make up some time. And so if we could take a 45-minute lunch instead of an hour, we did that last time and we did really well at it. So let's do that once again. Have a great lunch. Thank you.
Everyone feel free to come to the back of the room and grab a piece of cake. We're celebrating Vicky's retirement. Red velvet.
In the Advanced 2 Apprenticeship program, you'll develop the knowledge and skills to jumpstart a career. In the Advanced 2 Apprenticeship program, you'll develop the knowledge and skills to jumpstart a
We'll go ahead and get started in just a couple of minutes. You can finish your conversations. We are going to change the agenda a little bit and put the leadership report after the final motion. So enjoy your cake. It is.
And if Vicky can hear us, this is a really good case.
Very important.
I'm glad to hear. I picked out the flavor, so it's my favorite. So I'm glad you're enjoying it.
Outstanding.
That's what Jackie says.
I don't have any coffee yet. Really? So she doesn't have bowling.
I did. No, I didn't. A great bake shop just north of Albany, J&S. Clifton Park, just north of, in Albany County, but north. It is Albany, where's Saratoga? It is really good.
Or is Clifton Park the one that splits Saratoga, Albany? I'm not sure. Shall we? Of the presentation. Okay. All right, I think we'll go ahead and get started. You can finish your cake while we're moving along. Well, so welcome back. I hope you had an enjoyable lunch. At this time, we will enjoy a presentation on the University of Rochester Apprenticeship Program by our own Marilee Boylan, Director of Employment Programs for the Strong Center of Developmental Disabilities and the New York State Coordinator of Project Search, who was joined by Brandy Solomon, Employment Project Coordinator for the Strong Center for Developmental Disabilities, and Colleen Blagg, Manager of Apprenticeship and Workforce Development at the Manufacturer Association of Central New York. Please hold your questions to the end of the presentation, and I'll turn it over to you, Marilee.
Thank you very much. First of all, we just wanted to thank you so much for your support over the past 2.5 years. It's been a very exciting journey, and we would like to share with you today where we've been, where we are currently, and where we're looking to go, considering your support. You already know who we are, so we can move on past that part. Just a little bit about the Strong Center for Developmental Disabilities. We are a UCED, and our mission is to promote the best practice and inclusion with and for people with intellectual and developmental disabilities in their communities. And our vision for employment is that all people with disabilities should have the option for employment, no matter the complexity of the disability or the barrier to employment. So where did we start? We started with a very different model, and this is Advanced to Apprenticeship is a pilot project. In pilots, you go down the road and you may bump into something and then change directions, and that we did. So in the beginning, we started in partnership with Project Search. Project Search is an intensive transition program for the folks who have disabilities to learn work skills out of a business. And we were going to utilize that partnership for some of the social skills training and some of the skills for the students then to graduate and then move into apprenticeship. We did a lot of outreach to the various programs and the graduates, and we came up with one person who was interested in manufacturing at the end of our outreach efforts. And we soon realized that we needed to really expand who we were asking. We needed to have multiple age groups. We needed to have multiple areas. We just really needed to expand the pool of candidates. And when we expanded the pool of candidates, we lost our ability, because we had promised to provide soft skills and technical instruction as a part of this project. Once we did that, we knew that we were going to have to look for other partners to provide that training. And as we realized that the design wasn't going to work out for us, we did a deep dive into apprenticeship and pre-apprenticeship and what that was. And we're going to go into that a little bit further into the presentation. But we wanted to make sure that, pardon. So as we were looking for different design components, the Department of Labor has done a lot of work about making apprenticeship and pre-apprenticeship accessible to people with disabilities. And I found this article. Thank you for changing it for me. Thank you. You could go back one. Thank you. The 5 components of high quality pre-apprenticeship programs. And these are the 5 components. So making sure that the training curriculum is agreed upon by the registered apprenticeship partners, incorporating teaching and testing methods that support a variety of learning styles. So making sure that universal design concepts are included in the instruction, that there's hands-on training so that people can really learn the methods that in that way. And then having easy access to wraparound supports if they need access VR or OPWDD support, that they have access to those resources. And also kind of a shepherded entry from pre-apprenticeship to apprenticeship itself. So what we did was we incorporated these 5 qualities of high quality pre-apprenticeship programs into our current design. And in that process that we realized we needed training partners. We needed people who had vast experience in understanding the manufacturing industry and very experienced in instruction in that method. Thank you. So we do have 2 partners, and we'll talk about those partners more, but we're working with Mohawk Valley Community College, as well as Center for Workforce Development out of Rochester. And what we're doing is we're pushing in knowledge into the pre-apprenticeship project. So we're making sure that they understand universal design and learning techniques, as well as neurodiversity. And we're providing one-on-one consultation. So as the instructors are teaching our students, they have real-time people that they can say, oh, I'm not reaching this person. We're struggling with this aspect. And they will have people to go to and figure out better ways of helping them to succeed. We're also pushing in, because in apprenticeship is really driven by business. And after there's instruction from the career and tech ed institutions, there needs to be business partners who are hiring people. We also knew that we needed to give that same attention and support to businesses and making sure they had all the information they needed to help them understand how to support people with disabilities, including people that they've currently hired. And for the person entering the project, we knew that they really needed access to wraparound supports. The way that our model works is that we're using the disability resource coordinator through the workforce centers, and they're helping them figure out, okay, what supports do they need, and accessing those supports individually as people need them. The other thing that we really advocated for in this project, there would be a low teacher-student ratio, that they have access to tutoring, and then they have those wraparound supports. Seeing if I missed anything. So why is this important? So there's key findings from the 2021 Deloitte and the Manufacturing Institute Talent Study saying that by 2030, there may be 2 million unfilled jobs in the manufacturing industry. So as a part of that study, they also indicated that this industry really needs to look at diversity, equity, and inclusion and press on that hard and make sure that they're welcoming people into the industry. And at the same time, we know that 85% of folks with intellectual and developmental disabilities are not working. So we want to make sure that we're at the table to let the industry knows that disability is a part of their DEIA efforts. And Colleen is going to talk about what pre-apprenticeship and apprenticeship is, and how that differs a bit from, say, an internship. And she'll go into more details there.
Thanks, Marilee. Good afternoon. I am going to discuss briefly what pre-apprenticeship is. And so pre-apprenticeship is a concept that everyone in the nation, well, any workforce development organization in the nation is familiar with. However, in New York State, pre-apprenticeship, the Department of Labor has a specific pre-apprenticeship model called direct entry, which we'll discuss too. But just in general, pre-apprenticeship is designed to prepare individuals to enter and succeed in a registered apprenticeship program. So pre-apprenticeships have documented partnerships with at least one, if not more, registered apprenticeship program. And that includes classroom training, applied hands-on training, and support services to ensure success in the program. And in New York State, pre-apprenticeship programs also have to have companies with registered apprenticeship programs that are willing to offer your participants interviews for those open positions. So any successful participant in a registered or in a pre-apprenticeship program will receive at least one job interview for those open registered apprenticeships. So it's industry-driven training. I know we and MVCC have partnered with several companies in the Mohawk Valley region for one of these classes to make sure that the training that individuals receive in this program is industry driven and is going to prepare them for jobs that are available at the end. Let's see. Okay, so I think a lot of people think they know what a registered apprenticeship is. I know I thought I knew what a registered apprenticeship was prior to joining the Manufacturers Association. And in general, it's on the job training, right? So you have a mentor who is with you on the job and they're teaching the skills that you need to know to become a professional. But there are 5 components to registered apprenticeship, as you can see on the screen. So the first is business involvement. So you cannot have a registered apprenticeship without a business involved in the program. So what that means essentially is you have to be working at an employer in order to be in an apprenticeship program. It's not a training program that prepares you for a job after you're finished. You have a job day one of your apprenticeship. You're earning a paycheck day one. And you also have to have a program sponsor. So the Manufacturers Association, the Manufacturers Alliance are program sponsors of registered apprenticeship. So we will go out to different companies and we will start registered apprenticeship programs there. So MACNY, for instance, has over 50 companies that are signatory employers that offer registered apprenticeships under our sponsorship. So we've made it available to small and large manufacturers to be able to offer this training on site. So the second component for a registered apprenticeship is related technical instruction. So those are typically college classes that you're taking. It can also be online learning that you take, but it's industry-driven technical skills training, and the employer pays for that. So, you know, it's kind of like higher education, but without having to have that tuition bill at the end. So your employer is paying for you to learn these skills in the classroom. And the third component is on the job training. That's the biggest component. So you're learning these technical skills on the job and you're earning a paycheck at the same time. So the fourth component is a reward for skills gains. So you also baked into the registered apprenticeship cake is that you're earning wage increases as you are learning on the job. So for some employers, they'll say every 1,000 hours, you're going to get a 50-cent raise, for instance. So it's built-in raises, which is really nice. I know I would appreciate it if my job had built-in raises, right? So, and then the fifth component is that you earn a credential at the end that's recognized nationally. So this is like a journey worker card. It's exactly what you get from the New York State Department of Labor. And that card is valid in New York State, it's valid in California, it's valid in Florida, it's valid all throughout the United States. It's essentially, I mean, I was just at a conference yesterday and the Commissioner of Labor, Roberta Reardon, was there and she was talking about how registered apprenticeship programs are higher education, but without a bill at the end. So it's essentially a college degree, but by other means, alternative means. So at the Manufacturers Association, and most manufacturers are using this model to train their employees because they can't find them elsewhere, right? So they have to grow them from within. So that's the model that most of our member companies are choosing to train and develop their workforce of the future. Thanks. Sorry. Okay. So MACNY is applying for Advanced to Apprenticeship to become a direct entry program in New York State. I know I told you I'd talk to you guys about direct entry. So direct entry in New York State is defined by the Department of Labor. So it is a pre-apprenticeship program that is recognized by the New York State Department of Labor. And in order to be a direct entry program, you have to have all the components that we talked about before. You have to have the work readiness skills built in. You have to have support services built in. You can't charge tuition for your program. You have to have an industry overview and technical skills, and you have to have an employer who's willing to interview you for open positions if you're successful within the program. And in New York State, for direct entry, you also have to be in an underrepresented population. So the individuals in your program have to come from underrepresented groups. So we already have one at the Manufacturers Association called Real Life Rosies, and it's just a program for women, for instance, and it's a direct entry program. And Advanced to Apprenticeship, we are applying for that to become a direct entry program. And it's going to be open to all underrepresented groups, not just one underrepresented group. And the New York State Department of Labor has recently recognized individuals that have disabilities as part of those underrepresented groups. So it's now opening a lot of doors for these individuals to get the training that they need to get a good paying job. So Advanced to Apprenticeship, we want to be inclusive. So it's going to be a program not just for individuals with disabilities, but for veterans, for individuals, for women, and for racial minorities as well. So, and that's defined by New York, so. Okay. You're welcome.
All right. So like Colleen was saying, we are looking for Advanced to Apprenticeship to become a direct entry program, which means it is pre-apprenticeship. And so in its current model for pre-apprenticeship opportunities, we're looking for applicants who are comfortable with applied math and basic computer skills. So being able to do basic measurements and that type of such is what we're talking about when we're referring to applied mathematics. We need them to be 18 or older. This is because the industry expects this through OSHA, which is our National Occupation Safety and Health Administration. They set the rules about the restrictions and the limited hours that are contributed to people who are under 18. So being 18 and over kind of unlocks all of that. And most manufacturers are looking for that. We want our applicants to be interested in working with their hands and creating things, because we're offering this hands-on training, and hands-on experience is what they will gain when they are working with employers. That willingness to earn, to learn while participating in the pre-apprenticeship courses. So knowing that this is going to be an opportunity that there is continuing education happening from your pre-apprenticeship program straight into you working with that manufacturing business, getting continual related instruction so that you can advance through the steps of apprenticeship. And ultimately, being ready to have a high wage career in advanced manufacturing is our goal and outcome for every participant that is a part of Advanced to Apprenticeship. So our next slide, or our next piece is a video. This video it was created through Rochester's Technology and Manufacturing Association, who is a part of the MACNY's Alliance for our state. And it demonstrates people who work at Fala Technologies. And Fala Technologies is awesome because they're right here in New York State, and they believe in hiring diversely. They believe in giving people with disabilities an opportunity that they've never had before. So this video really highlights folks who are already working for Fala and our ultimate goal that we want for all participants with Advanced to Apprenticeship.
In the Advanced to Apprenticeship program, you'll develop the knowledge and skills to jumpstart a career in the growing industry of advanced manufacturing.
I'm a New York State certified toolmaker. So on a daily basis, I program the CNC machining centers.
And I inspect parts made either on the floor or that are ordered from outside subcontractors.
Manufacturing involves logistic people, shipping people, estimating people, management, and everybody in between. You can go in any direction basically once you get a foot in the door and establish yourself as a hard worker willing to learn.
Our dedicated team will help remove the barriers to your career path, connecting you to the additional services and care that you need to reach your full potential.
It was a pretty smooth transition, learning the different pieces of equipment that we would use as I went along, asking questions if I needed to of my manager.
I did have a lot of anxiety when I first came, for quite a while, afraid like the smallest mistake would get me fired. I've over time come to realize that the quality of work I do here is appreciated. Everyone is glad to have me here, and that's kind of helped lower my anxiety considerably.
Having a steady stream of income, being able to pay off my student loan, a sense of direction, making so I don't feel aimless or without purpose.
Seeing that independence lets you know that you've done your job right. You know, as a parent, that's your goal.
Don't be afraid of failure. Failure will just be another teaching moment for you.
All right. So we really are so thankful for the videographer and the sponsorship for this video. We've been using it, go back to the slides. We've been using it, thank you, for our marketing and being able to show the light at the end of the tunnel. So this is the goal. We want you to be in manufacturing positions that, you know, typically were untapped by people with disabilities. So our educational partners, we're working with Mohawk Valley Community College in Utica, as well as the Center for Workforce Development in Rochester. At Mohawk Valley, which we have as MVCC, they are offering a basic to manufacturing course that is actually in session right now, and we'll be meeting in a couple hours. And so they're getting a great menu of different parts of manufacturing to taste from as they are learning about the different jobs that are connected with manufacturing that they can get into. And of course, with that goal of them getting into companies that offer apprenticeships, that they will be able to take some of this related instruction they got at MVCC to advance them forward. The other part that they're getting at MVCC is a OSHA 10 certification, which is that first level of OSHA. And in most manufacturing cases, they will need to continue to grow on those hours in OSHA to be safely trained in the work that they're doing. At Center for Workforce Development, which we also call CWD, they are offering the opportunity for us to push into 3 courses. We have machining, industrial operator, and welding. And the great part with them is the opportunity for students to become certified manufacturing associates. That's what the CMFGA stands for. And that just gives them another piece of paper really to add to their collection and that resume booster to show that they're dedicated in the field that they're looking to get into. So the other part with CWD is because they are a career and technical education institution for adult education, they have a huge menu of different courses that they offer. So with our pilot of Advanced to Apprenticeship, we're focusing on manufacturing, but they also have courses that we will potentially be able to grow into in healthcare and construction, as well as transportation. So what do our educational and business partners get? They gain support that is wrapped around increased outreach in the disability community for our educational partners, as well as our business partners, making sure that on the education side, they are truly, really the education and business sides, that they're leaning into their DEI initiatives and hiring diversely. That's that next bit. Diverse applicants is what both the education and the business get. Those untapped disability communities and providers that have a workforce readily available can be able to not only get the training on the education side, but that entry into manufacturing as the new pipeline that is needed in the workforce. So training, we know that if you're bringing a group of people or anybody new to a situation, it is important that wherever they're going, that road has been laid before them to help, smooth some of those edges out. So training in neurodiversity for our business partners, making sure they understand what accommodation means and that it is important to allow people to have them if they need them. On the education side, making sure that principles of universal design learning are being taught to our instructors, as well as neurodiversity training. And then the linkages. The other part of this whole puzzle is all about linkages. There are so many great people doing great things in our community, and we want to make sure that not only the educational partners, but also the business partners are linked to our community resources like our one-stop shops, as well as those state agencies to help students along for the wraparound supports they may need. One thing that I do want to note as I'm moving forward is the neurodiversity training that we set up at Mohawk Valley Community College. On the first day that we set it up for instructors and we put it out there promoting, we filled the class. So that is something that is showing us that not only is the interest there, but the need is there to support our instructors as well as our businesses with understanding how to embrace greater diversity. So Advance to Success. Right now, I have a picture up of Rodney. Rodney is one of our participants at Mohawk Valley Community College. He was one of our very first applicants who was very persistent and determined to make sure that he could be successful in the next phase of his career. So his quote, "Tough times don't last, tough people do." In 4 months, this is from him, sorry. In 4 months, my life transformed with involvement with programs like Advance to Apprenticeship and connections through Working Solutions. After nearly a decade of incarceration, I came home with determination to improve my family's life and change my destiny. With support and my consistent efforts, I am currently employed with Wolfspeed Manufacturers and on the path to advancement. So he was able already, as a result of the connections that he tapped into, those linkages, to be employed with Wolfspeed while he's in our pre-apprenticeship program at Mohawk Valley College. And on that path to move from currently a manufacturing tech into equipment tech. And then ultimately, his goal is to become an equipment engineer, which will continue to tap into those related instruction hours and provide him with additional certification through registered apprenticeship. So to ensure our participants have appropriate opportunities for support in the classroom, we've also have been providing that UDL training, starting with the overview of the program and making sure that our instructors understand all of the different parts that are included with UDL, as well as doing a needs assessment so that we can really know what the instructors are looking to learn as well, and matching that all together and being able to package it and give it back to them for their training purposes. So after our first satisfaction survey from our UDL overview, Universal Design Overview, these were some of our instructor comments. I think the program is great. I've been in manufacturing for 30 years and I have multiple family members with disabilities. To know this is being offered is fantastic. Another comment was, I thought the presentation was very informative and a great resource for a new instructor like myself. I look forward to utilizing the resources as needed to help students attain their best while in and out of class. So that first day, our neurodiversity training filled up at Mohawk Valley Community College. At the Center for Workforce Development, we got great comments like this from instructors. So once again, showing us that the need is there and the interest to be able to support people with disabilities and without. So partnerships, this is all about partnerships. The linkages, the businesses, the employers, it all comes together through collaboration. So our first partner that we have listed here is the Workforce Development Institute, who has been a part of our braiding funding. So not only having the support of you all, but also looking into other opportunities to gain additional financial support. They've been a part of helping us to beef up some of our finances with our universal design training. And then we have MACNY, who is represented by Colleen, our lovely Manufacturing Association of Central New York, who has been a wealth of information and knowledge in helping us push everything forward, as well as in the Rochester area, Rochester Technology and Manufacturing Association. And then when we talk about those wraparound supports, we have Access VR, our adult career and continuing education services, as well as OPWDD, who is our Office for People with Developmental Disabilities, who provide those wraparound employment supports if a person is eligible and if they need it. So like your job coaching and maybe some resources with tuition assistance if needed and such. Our one-stop shops, all about the workforce development. We're partnered in the Utica area with Working Solutions, as well as in the Rochester area with Rochester Works. They house our disability resource coordinators who are making sure that people have the right linkages, whether that be benefit advisement or additional soft skill training, to make sure that as they're concluding their training programs, they're ready to go into an employer and start working. And we also have the National Institute of Innovation and Technology Career and Continuing Education Services, who offers us a national perspective national perspectives in apprenticeships and the different resources that may be available across the nation.
So where are we going now? If we're able to extend in the next 2 years, of course, we're just finishing off our first literal year with people. So we have 8 people at Mohawk Valley Community College. We're currently recruiting this spring for CWD. We want a year to run, and then we would like to improve. Okay, so what do we see that has done well? We want to run evaluations and then make necessary changes we want to do to make the program more effective. Okay. We also want to build sustainability. So we want to make sure that the career and tech ed institutions have they both have the marketing so that they can also market and reach a diverse group of students. We also want to make sure that they have the community resource they're linked in with so that they can provide those community resources to their students. We also want the career and tech ed programs to have the knowledge and resources so that their instructors and their faculty and staff feel comfortable in including all people, including people with disabilities. And we want the Strong Center for Developmental Disability be able to fade over time so that they can continue on having a good pipeline of candidates coming into their programs who have disabilities. We'd also like to share out what we've learned. In years 4 and 5, we would love to have more opportunities. It's a really hot topic right now. There's tons and tons of webinars about how to make apprenticeship and pre-apprenticeship more accessible to people with disabilities. And we would love the opportunity to work with both the state and national groups to share the knowledge that we have learned. And we'd like to explore building a statewide coalition. So there are lots of groups throughout the state of New York who are currently working in this realm. And it would be really neat to convene a meeting, sit down and talk about all the learnings that have been made, maybe some of the common barriers that we might have together, and then figure out whether an ongoing coalition would make sense to maybe push on some more systems barriers that we can move together. We're always stronger, better together, right? We want to continue sharing our information with other career and tech ed institutions. So for example, SUNY Rockland has already reached out to us, and they also would like more information about universal design and learning. So if there's so much hunger for this, how can we bridge that? And since we are going to create a video library, that library can really be pushed out to more and more career and tech ed institutions. And then it'd be great to have staff go and do an in-person neurodiversity training and talk about the neurodiversity lens, really begin to have conversations with other institutions. Continue to educate and outreach to businesses. I mean, this is a common topic over time that we need more businesses to come to the table and build cultures that are open and accepting and are supportive of people with disabilities. And then can we create more employment opportunities, not all of the students are going to end up in apprenticeship, and we know that, but we also see as a success is employment. So is there a point where students who may be coming into the classes, maybe the classes are too technical, and maybe folks go straight into employment. So how do we build those bridges so there's never like a failure, so we just start to move people in different areas where they can be successful on the job. We would love to, in partnership with the educational institutions, MACNY, RMTA, and the workforce boards, create an exploration day for youth. So can we also look younger? So they're part of the issue in manufacturing in general is to get people interested. I think there's a lot of old stories about what manufacturing looks like. Are these dirty, scary places? Are they not safe? And these are not true stories anymore. Every single institution, industry that I've walked into has been a very exciting place, a very, I don't know, it's just a very creative place, and somewhere that I would like to work, and I think just sharing that information with more people, building again that pathway for people with disabilities who are younger to think about this as a career opportunity for them as well. And I think also building in some more ideas for teachers and parents and individuals that this is possible. So in the, when you watch a video, you don't get the backstory of who's in the video. And some of the backstory for the video, those of a couple of the folks that were in there, one gentleman, it was amazing that he was even in the video because he'd never talked to his boss when they were first met. He just refused to talk. He was not comfortable talking with people at all. And Frank from Fowler Technologies, knew that this gentleman was highly skilled in what he was doing. And he also knew that this gentleman wanted to be in industry. And so Frank said, okay, does he want a job? Okay, well, come on board. And so he got him to come on board, and he's really been a fantastic employee ever since. The other gentleman who had a lot of anxiety, he worked at McDonald's and really struggled for many, many years in finding employment at all. But because his mind worked in a very certain way, a very detailed way, he could apply that into manufacturing. So just so you know some of the background context. So yes, to wrap that thought up, we just want to encourage more people that this can be a path for folks, and a great path. The wages are quite high. So what are our year 4 and 5 targets? We really want to encourage more youth with disabilities to explore manufacturing as a career path. We want more students to enter apprenticeship and jobs. We would like to open up the apprenticeships to be other than manufacturing. So as Brandy was saying, can this move into healthcare or other industries that also use the apprenticeship model? Can we support other career and tech ed institutions across the state to adopt more universal design principles? And then initiating a statewide collaborative to share what we've learned with each other, and then build our strength together. Do you all have any questions? That was a lot to throw at you.
Hi there. I'm Eileen Borden. I'm from the Office of Special Education, New York State Ed Department. So new to kind of, representing, there was someone else that used to come to these meetings, but it's a different office, but we have a whole office, Career and Tech Education. And so I didn't know if you've linked in with that office at all. And they happen to be coming and presenting to our Commissioners Advisory Panel next week, specific on CTE. So that's what kind of perked me to see whether you've made any of those connections, because if not, I could see if that would make sense, for you to connect with that office.
That would be wonderful. We've only made connections at the local level to
Okay.
the Career and Tech Ed and the BOCES. But we haven't made it up the chain, so that would be fantastic.
Okay, okay. Yeah, after I'll just get some contact
Thank you.
info. Yeah.
Thank you.
Katrina has a question.
I have a question. My question is, how are you reaching out to the younger students with IEPs?
We will be partnering with local school districts. We don't have an exact plan yet. I know that we will be partnering with Access VR, so probably a lot of folks who are involved in pre-ETs. We will be partnering with the manufacturing, both RTMA and MACNY, to kind of fund this type of project to go. And I think a lot of marketing and outreach as well.
Thank you.
Thank you.
And I'm going to do a follow-up to what Trina said. It's Eileen here from the Office of Special Ed. So when she read my mind, like, well, how are you accessing? And we just had, we have a youth advisory panel that also helps advise the Office of Special Education. So we just had the first quarterly meeting. And so these are kind of highly engaged students. And actually one of our presentations was Access VR. And I know Access VR is doing a lot of marketing right now, really to kind of get the word out. But I was really surprised that here are some very highly engaged youth at various, they had seniors down to, younger high school grades where they weren't aware. And we really used a lot of the meeting to make sure they were hooked up with, okay, do you know who your VR counselor is? So the marketing piece is something really to kind of, focus on, because here I was surprised because I would have thought, okay, they would have known who their kind of VR counselor was. But again, I mean, they're focused on a lot of other things in high school and so it might just something that might just not have tapped into what they focused on. But I think really the marketing is huge for really getting the word out. And then at the local level, whether you're working, you've got so many different kind of school settings, whether it's at the public school or BOCES or approved private schools, and where are you going, so Access VR is a great way to kind of start, but yeah, getting the word out is a key thing.
Can we use you as a resource and we can plot?
I think the fact that you've got Access, VR, I'll hook you also up with the, the CTE. And certainly kind of much broader for how do you get into the educational system, and whether are you looking at statewide or geographic. But I think between those, you'll have my contact, but I'll hook you up with those two entities, because you really want to go right at and you said those that are right involved with the pre-ETs and
I think what we've learned this year, that the closer that we can get to families and individuals, the better, because it's hard. Everybody's really busy and trying to negotiate and juggle all the balls that they have in the air. It's so much better if we can, whether we're doing Zoom meetings for parents, or we have to get down to the people who would enjoy the project, the program.
And the other thing I would just add, I mean, transition planning starts at age 15. So it's really getting at kind of that kind of age group as they plan out their kind of career paths.
Marilee, building a statewide collective of any sort is promising and challenging always, I think. I was wondering if you might share how you plan to go about doing that.
I think I would start small with just exploring. So I would have maybe an initial meeting to get folks together and to talk about what their experience has been in their role in getting more people involved with disabilities into manufacturing or apprenticeship. And just start with a learning day. And then see if we can build momentum from there. I think that it would take each of the stakeholders to decide if it would be worth it to them, and then kind of co-evolve something with, well, okay, so if there's an interest there, if this would be helpful, how often do you want to meet? But really make it a decision of the group, but it would have to be beneficial to everybody. People would have to buy in. Yes.
Thank you.
And MACNY is part of a statewide alliance of manufacturers associations already. So we do kind of have that framework already built. And we do have manufacturers intermediary apprenticeship program alliance, and it is statewide, including in New York City all the way out to Buffalo. So
Thank you. Julianne?
Thank you. Just wanted to introduce myself, Julie Lyman from Access VR. I did just want to take the opportunity and share that for Pre-ET specifically, we currently have an MOU in works with Mohawk Valley Community College in specific, but each of our district offices also have a TASE unit, Transition Youth Services, to reach those students with disabilities and youth with disabilities. So it sounds like there's some connections to be made with us as well. And I'd be happy to share my contact information.
Thank you.
Ben, you have a question?
Yeah, so hi, this is Ben. I'm the parent member. So first one, I will welcome that if you reach to the community, like family member, explain what this program is about, because I can guarantee you like a majority of the family never heard about this one, but this is great. My second question is that is this model only for the manufacturer jobs, or is that apply for the service area industry there too?
So we've started the initial pilot in manufacturing, but we're hoping that it does expand out into other fields. So the Center for Workforce Development has mentioned that they're currently piloting in manufacturing, but would like to extend into other areas. And I know that they teach into the healthcare industry, like phlebotomy and CNA certifications. And so I really could see how they could expand it over time. And we're hoping that that's the case.
Yeah, because I'm asking question is that because I know that many of the manufacturer job is not in the downstate area, like in New York City area. So if we can have the service industry follow the model, then we should have lots of job opportunity in the New York City area. So that will be great for us.
Do you know about hang on, I'm turning to Colleen about service industry and apprenticeship.
Well, I can't speak specifically to the service industry in New York City. I know that SUNY recently got funding to start with some statewide apprenticeship program representatives. So they are assigned all throughout the state. So those individuals are starting to push into other industries besides manufacturing and construction to help businesses start their registered apprenticeship program. So that is something in the works. I know for New York City, especially, the mayor had some commitment to have like several million people in apprenticeship programs. So I know that's something that it's definitely in vogue to have an apprenticeship program, and it is expanding rapidly throughout New York State and into other industries besides construction and manufacturing. So I wouldn't be surprised if you started seeing those opportunities available in the next couple of years.
Vincent?
Okay, thank you.
There we go. Did you say you're going to be reaching out to the local BOCES? Because if not, it would probably behoove you to do so because they're able to reach the local school districts pretty quickly.
We luckily we were able to do a presentation for all the transition teachers in the BOCES in Rochester, and that was super helpful. We had an open house event recently, and one of the transition teachers was there, and she shepherded a couple of our students there as well. So yeah, it was super helpful to be able to talk to BOCES.
Yeah, because they are a big resource, and more you can leverage on that, the better.
Agreed.
Even in the Mohawk Valley area, we were able to speak with BOCES and get connected to the superintendent of schools for the entire area. So I agree with you. They have definitely been very great in helping us to connect those dots.
That's good. Thank you.
Shamika?
Just very simple thing. I might have
been out of the room when you did this, but I didn't hear the presenters introduce themselves.
I'm Marilee Boylan. I'm the Director of Employment Programs for Strong Center for Developmental Disabilities.
My name is Colleen Blagg, and I am the Manager of Apprenticeship and Workforce Development at the Manufacturers Association of Central New York.
I'm Brandy Solomon. I work with Marilee at the Strong Center for Developmental Disabilities through the University of Rochester.
She's running this project.
All right, any other questions? Yes, Joanne.
Yes, I just have a question because since it's an apprenticeship program and people are being paid to learn, what are some of the obstacles and questions that family members have regarding benefits in terms of medical benefits, and how does that work?
So I'm glad you asked that, and that we know that that's one of the largest barriers. We intentionally kind of wove in the disability resource coordinators that are based out of each of the workforce centers because they've all been educated in benefit planning and navigation. And so we are really closely offering this as a service to the students so that they have information that they need, so they know that they can work without fear of losing their benefits.
And I know it's not going to be for everybody, but these careers are really high paying jobs in manufacturing. So for instance, one of the trades that we offer is the manufacturing engineering technician trade. And the average salary for that in New York State is $96,000 a year. So these are not jobs that you're making, $16 an hour. I mean, it might be to start, but by the time you are trained up throughout the apprenticeship, you are making a sustainable wage for a lot of people.
Other questions? All right, well, thank you very much for an engaging presentation today. Jen Goldeman asked me to remind you to make sure you fill out and submit the conflict of interest form that's in your packet, and try to do that before you leave today. Jen, is that right? So this time, Jackie Hayes and Kim Berg will update us on program priorities.
All right, excuse me. So we will get started on our priorities. So for folks that were with us at the February meeting, we kind of tried to start this new process out. So this is something that we're going to be doing every October, although we did it in February for our first kind of taster in this new process. But basically what we're doing is wanting to get input from you all about big picture priorities. So certainly there's no shortage of projects that we can fund. There's no shortage of areas of work that we can do, but we can't fund everything. Obviously, you guys are voting on motions, so we know which projects are kind of moving immediately ahead, but we also want to have a list of projects ongoing that are priority areas, but that maybe we can't fund right away, but we don't want to lose sight of. We still want to make sure that they're kind of on the horizon at some point. And, the benefit of that is twofold, really. One is that it allows us to move some stuff that's already been voted on. So say we got some extra money from the feds, or say one of our projects was underspent, then we would already have a project in place that you all have voted on, approved, you've given your input, and it's ready to go. So we're not trying to scramble to create something, but we already have a high quality project ready to go out to the field. So that's one benefit. The other is that it really sets us up for the future as well. So we obviously operate on a 5-year state plan. Right now, we're going into year 3. I was going to say 4, but I'm like, no, don't fast forward time. We're going into year 3 of our current state plan. So we're a little over halfway. But we need to start thinking ahead to the next state plan and what's going to go on the next state plan. So this also helps us kind of think about the things that if we don't get to it in this current state plan, we can do in the next round. So we have several priority areas. Once we get to it, there is a list that looks similar to the list that you guys saw in February. For those that are new to the council or weren't at the February meeting, this is going to be a whole new process. So welcome. But yeah, as I mentioned, this is something we'll do every October. So it really is to make sure that we're kind of on the pulse of what you guys find the most important. And, you know, likewise, there might be some things that you want to fast track. You want us to move forward more quickly than originally thought. And that can be related to changing conditions in the field or, you know, any number of things. So again, just a way to help us kind of prioritize what is important to you all and what's going to be most impactful for the field. So next slide, Drew.
Great. And so just to bring everyone up to speed, as Kim mentioned, the first time we really rolled out this new process to get council member input on our priorities was at the February 2023 meeting. And so based on the results of that meeting, and we presented these at the committee meetings too in the spring, but basically here are the top priorities that council members had kind of ranked and said were amongst the highest priorities. And they really do track with what we're hearing, you know, I think across the state from family members and self-advocates. So employment was a huge priority, housing, transportation, you know, really major life areas. Then advocacy, an employer toolkit, financial literacy, dental health, digital divide in the courts. And since February, we've brought forward, you know, we've had one other meeting cycle and then this one. And so we've brought forward funding motions on employment with that employer toolkit, transportation, self-advocacy, align with that advocacy initiative. And then we did bring forth a motion on the Onondaga Nation, as you'll remember. And while it wasn't on our priorities, we do have, you know, there is kind of a want on the national level for us to work with Native American communities. And so since we saw an opportunity to do that, and as you know, part of the input we've gotten from our DEIA work group, you know, there were a few motions that we put forth during this time too. So then the apprenticeship program in line with employment is at today's meeting, multicultural housing in line with housing, and there will be more housing motions to come too. And then the Special Olympics, because that helps to meet our targeted disparity objective, which is one of the objectives in our state plan that we do have to do work on as a federal requirement. And so this is kind of a recap of February and then where we are right now. But as Kim mentioned, we want to make this an annual process that happens each October. So that's why we're doing it again at this meeting, and then going forward, we'll be doing it every October. So next slide.
Yep. And here you guys will see, so this is our current priorities list. So this reflects all of the projects that you all have voted on, but that have not yet gone to the field. And we've even added that priority section on the left that talks about kind of low priorities. So things that are important, but don't need to move immediately, versus the high priorities, the things that, you know, if we were able to have some additional funding, that we would want to move more quickly. So, so we plan to add to this list based on the prioritization that you guys do today. And like Jackie mentioned on the previous slide, you know, this also, we've moved some projects off of here that were priorities based on our last conversation and that are going to be going out to the field. So transportation is one of those. Our transportation small grants was on this list. We do have some additional funding available. That was a high priority area for folks. And actually, you know, one of the areas where we always like to have at least one project in transportation. So that's something that we moved off the list and is going to go to the field toward the end of the year. All right, next slide, please.
Great. So today's meeting, how basically we're going to get your input on priorities is there'll be a handout in your packet, which will look like the screenshot on the left there, and, you know, entitled New York State CDD project ranking. For those folks who are remote, we'll have a link to a survey that mirrors this ranking sheet. And basically what we're going to do is Kim and I will provide a summary of each project. So I know some of the input that we got in February was that there wasn't enough time and not enough information was provided about some of the projects. So we've allotted more time at this meeting and are going to go through project by project to give more background about each one. So it's easier to make a decision. You have enough information to make a decision about how to rank the projects. And basically on the sheet, so you're going to assign either a 1, a 2, or a 3 to each project. 1 means it's a low priority. It can, it's important, but doesn't need to move immediately. Medium, important, but, kind of in that middle road. And then high is needed immediately. So basically, assigning a 3 is really saying this is what I think is a really high priority that if you're going to move quickly on, that's what we want to see moved on. So that's basically what we're going to be doing right now. And then, so you should find those in your packet, and then we'll go through and basically describe each of the projects as listed on that ranking sheet. Does anybody have any questions before we kind of dive in just about the directions of completing the forms? Or
And just so folks are aware, as Jackie said, that form should be on the left hand. When you open your folder, it should be on the left hand side. So folks can go ahead and pull that out. Drew, I think you can go to the next slide. Oh, it's already there. All right. And yeah, again, as Jackie said, so these are all the kind of areas of work that have bubbled up that we've collected from you all and from other outreach and things that we're hearing from the field. And all of these different project areas are in a different place as far as development. So that's why we wanted to kind of run through each one specifically to just let you know, because I think that was some of the, misunderstanding or confusion last time is that people were thinking that these were all projects that we had developed, and they're not. So they're in various phases of development. Some we don't have, we know we want to do work in this area, but we don't have currently a vision for what that would look like. Others, maybe we've presented a concept paper, but a motion hasn't been voted on. So you're going to see kind of the range of development as far as the research and the actual program design. So the first one is decision-making. So obviously we've done a lot of work in the area of supported decision-making and alternatives to guardianship for folks on the Individuals and Families Committee. You'll recall that earlier this year we had Jonathan Martinez from Burton Blatt Institute present on the evaluation that they did of supported decision-making New York. And he mentioned some different opportunities for continuing the work of supported decision-making. So we wanted to put that on the list. That continues to be a hot topic of conversation. And what that continuation of work would look like is raising awareness about supported decision-making and the different ways that that can look. So obviously the DDPC funded supported decision-making New York is one such model, but really, we want to kind of move beyond a one-size-fits-all approach. We know that supported decision-making happens. It happens in different ways for different people in different circumstances. And so we want to kind of spread the word about the different ways that that can look for a person and their family. And then, so this is really, we haven't presented a concept paper. There's been no funding motion. So it's really just kind of a vision for continuing the work at this time.
And I can talk a little bit about dental and oral health. So where the status of where it's at was the concept paper was presented to the Community and Systems Change Committee December of last year. And basically the idea would be to focus on, potentially rural areas or building capacity in more remote areas of New York State where maybe there aren't a lot of good providers, or basically, there needs to be some training and capacity building. So there's a couple of different approaches we could take. Again, that training for rural dentists by experts on serving people with DD. We're lucky in New York that there are some, NYU has, a special need dentistry clinic that's, among the top in the nation. And they could be potentially an organization that trains other dentists in other parts of the state to build capacity. Or, basically we could also expand some of the small grants. We have a small grant right now with Toro College, providing oral health training. So we don't necessarily need to decide on the direction today. It's more on, do you want to see something around dental or oral health come to the next meeting cycle, and then we'll kind of iron out the details. Can you go to the next slide? So the next project area is the digital divide. We did bring a concept paper September of last year to the Community and Systems Change Committee. And that really, again, came out of, the experience of COVID and really wanting to address the digital divide. We got involved in that New York State level effort around digital equity and have learned a lot, I think, in being part of that and seeing what New York State and the federal government is doing to address digital equity. And through that have learned about these digital navigators, which are based at New York State public libraries and really are a community resource to do trainings on, how to create an email or just navigate things online. And, those digital navigators aren't necessarily given a specific training on working with people with developmental disabilities and could potentially do some curriculum or deliver curriculum, at the local level to really increase digital literacy and digital skills for people with DD. So that is, where the status of that project and what it would look like.
The next one is customized employment. So we've talked about this idea before when we've worked with our systems partners. We have a contact at the New York State Employment Service System, which is housed in OMH, but it's called NICE. Customized employment training for folks who work with people with developmental disabilities is really important and not a philosophy that everyone follows. So we realized that we could use some capacity building and actually training people. What does customized employment look like? How do you do customized employment for somebody? Because sometimes people will think they're doing it, but if you look at really the philosophy behind it, there's a lot more involved. So we'd love to fund a customized employment training for professionals in the field. And obviously the goal would be to facilitate employment for people with developmental disabilities. So we haven't done a concept paper or a funding motion, but obviously this is in the area of employment. So we did want to bring it as an option today.
Right, so the next one is the support aid pilot, and a funding motion was actually presented in May of this year to the Community and Systems Change Committee. So that's where it was at, and it was a 3-year pilot, and basically the committee decided that we needed more work on that and we'd continue to refine. But basically the aim of it would be to create this position for people with developmental disabilities to work at DD agencies as a support aid. And so creating this kind of new role and new position and really thinking about creating jobs for people with developmental disabilities, as well as addressing some of the staffing crisis that DD agencies are facing. The other reason why, we kind of decided also to give it a little bit more time is we did find out that Access VR and a number of other agencies have gotten some federal funding to do an initiative in this area. So we just wanted to make sure that we would be aligning that with any other interagency initiatives or other work that's going on in the state. But that's something that could, we could basically incorporate, some of the concerns, meet as a work group and refine and bring that as a final funding motion. So that's the stage that that's at.
The next area would be family and caregiver support. So this is one of the ones where we don't have a model. We don't have any kind of proposed direction at this point in time, but we always do like to have projects focused on family members, family advocacy, building capacity, skill building. The project that we currently have focused on family members is FEAT, the Family Employment Awareness Training. So that's very specific to supporting families to raise expectations around employment and what's possible for their family member. But outside of that, we don't have much in the way of family and caregiver support training, looking ahead for the rest of the state plan and for our next state plan. So that's why this is on the list. But as I said, we don't have any projects. And so there hasn't been a concept paper or a funding motion yet.
Great. So the next one is financial literacy. And a concept paper was brought in April of 2022. And we had actually a prior Excelsior fellow who really helped us to develop this project. And there was a work group that met and looked over a number of different types of curriculum around building financial skills or financial wellness or financial empowerment training for people with developmental disabilities. And so the work group really in reviewing a lot of the different curriculum and models, like the Your Money, Your Goals curriculum. So that's basically what it would look like. We'd be bringing a funding motion and then releasing an RFP if that was a high priority to move forward. The other one is housing. Not so long ago in September or last month at the Community and Systems Change Committee meeting, Drew presented a concept paper on shared living and identified 4 different areas or directions that we could possibly go. So research, information sharing, and raising awareness about shared living as an option. In New York State, we could do something around roommate matching or enhancing a toolkit on shared living. So if that's a high priority, that's something we could, bring a funding motion to at the next committee cycle.
All right, the next area is sexuality and healthy relationships. So this would be a continuation of the Elevatus work that recently concluded at the earlier part of this year. This isn't to say that this a project would necessarily be with Elevatus, but continuing the work of providing education to people about sexuality and healthy relationships and how to support people with developmental disabilities to fulfill those relationships if they so choose. Catherine from Elevatus presented at our September Individuals and Families Committee meeting and identified some possible future directions of work, including something that she really learned throughout her work in New York is that people with developmental disabilities are really hungry for just basic kind of sexuality and health information. And oftentimes we're not able to access that information. So even kind of a step prior to her training, because her training is really about training people to train people on healthy relationship skills, but this would even be a step back about basic sexuality and health information. So some skill building for self-advocates. She also did identify that what we funded was a train the trainer model. And for the people who work at provider agencies, some of them were really able to kind of take the training and run and bring that back to their peers and other staff. And in other places, there were a lot of barriers to that. So something that would be really informative for the CDD would be to learn about those barriers. Is it a provider culture issue? Is it being kind of burned with other tasks and this kind of falls to the wayside, or what are the barriers to actually implementing these trainings at the provider level? So more sort of evaluation and data collection could be involved as well. We haven't done a concept paper, nor have we done a funding motion. So we have a lot of kind of opportunity to shape a project in sexuality still.
Great. The next one is a grant with Tech Kids Unlimited. So they presented at the September 2023 or last month's CSCC meeting. And, one of the reasons why we were kind of attracted to the program that they do is because of the age group. They focus on kids as young as 9 and up to age 24, 25, and really give them a number of skill-based experiences, whether it's around game design or social media content creation, things like that. And Kim and I actually got the opportunity to visit the program and kind of see it in action. And they have a number of different programs, which I think, Beth kind of shared a little bit about. What was neat to see was first, I think, how diverse the students were who were participating, across the board by age, race, ethnicity, disability status. So that was like really, exciting to see in the program. Some of the neat parts of it too was a newer program that they had rolled out was this internship program where they basically build relationships with companies that want to, basically have paid internships for students with disabilities. And then Tech Kids Unlimited provides like a working space so that those students can come and get support from TKU's staff to be successful in that internship that will hopefully lead to a job. So there's a couple of different directions that we could go. Potentially, we could expand some of the youth programming that they do around skills and, job skills, employment and internships to other parts of the state. Pilot a new program, add a new component. But that's something kind of in the area of employment internships for younger people that that could be a priority or could be brought at the next committee cycle.
All right. And then the last one is an innovations small grant opportunity. So for folks who are with us during COVID, we were able, and really the first time in several years that we had done a small grant opportunity where rather than these $100,000, $200,000 grants, we offered smaller grant opportunities, which really enabled us to work with smaller, more community-based organizations. So we want to do something similar to that, not COVID specific though, but really innovations that are happening in different parts of the state that we're not aware of and that, thus far we haven't heard about. We really want to open up some opportunities for organizations that haven't worked with us yet to apply for funding in kind of a lower stakes way, in a smaller way, but to fulfill a need that they've identified and a creative solution that they've identified. So for this one, we haven't brought a concept paper or funding motion, but these types of opportunities like the innovation small grants and then even the transportation small grants that I referenced earlier are great ways to fill gaps where we have kind of an uncertain amount of money. We can sort of set a range that's available and then people can apply based on that range. So these are really great projects to be able to kind of put out on shorter notice because it takes less time to draft the request for proposals, and we can be flexible around how much funding we have available. So, and I will add to this too that occasionally as a funding entity, we do receive kind of emails from the field that are like, hey, we have this great idea. Can you fund us? And generally speaking, we can't fund somebody that comes to us off the street. It has to go through a formal process. But having a small grant opportunity and running one of these on a semi-regular basis allows us to be able to fund some of those great ideas in a formal process. So it does allow us some flexibility and again, to work with some entities that we haven't worked with previously. So at this point, those are all the ideas that are listed on the ranking form here. So folks can go ahead and fill out that form. While you're filling it out, you can ask Jackie and I questions if you have some clarifying questions. I will add as well, all of the topics that we mentioned are on the front of the form. On the back of the form, there's a write-in space. So if you have some ideas that we haven't covered and that you think are really important, then please let us know and rank those. And we will add that to the list. And we'll collect these forms from you. And then I know folks on the remote access are getting a Survey Monkey. So we're going to tabulate all the results and then we will provide the results of that at the next series of committee meetings. So those will be taking place in January. And then we'll also do a recap at the full council meeting too, so that we can have kind of the larger conversation. But as Jackie mentioned, you'll start to see some of these project areas. You'll see those funding motions coming up at the next series of meetings. And Drew, I'm assuming everybody online has the survey link. Okay, awesome. Oh, and that's why it's quiet for all our remote folks. People are just filling out the form. So if you don't hear anything, we are still here. We're just filling out our forms.
I have a question, Kim, while people are filling out their forms. Have you found that the small grants have gone to startups or do they go to other types of projects?
I would say both. So we definitely have, and I'm really thinking about the COVID grants, but we had definitely some smaller organizations that were just getting started, but we also had some providers apply too. So it's, some well-established providers. So it's really kind of all over the board as far as thanks, what we received. But I think, as I mentioned, just there's almost in a way, I mean, the reporting is still the same. The contract is still the same. I was going to say there are fewer strings attached. There aren't really, but I think it just feels a little bit more accessible for people to be able to implement something on a smaller scale and feel confident that, yes, we know we can do this project effectively because it's a little smaller and easier to manage, and sometimes I think a little bit more clear cut, whereas some of our bigger projects, obviously those are incredibly important and we're going to continue to fund those, but there's more unknowns, there's more loose ends, there's more problems to solve and questions to figure out. So I think it just allows a different kind of subset of applicants that we don't receive on some of our big grant opportunities.
Thank you.
Yeah, I think I would add to that, like Kim said, like there was new organizations that we learned about that we'd never done grants with through even the COVID grants or some of our small grants. And that was what's kind of exciting about it.
So I have a question. On the online form, the proposal project, is that the new project we proposed, or is we just pick up the current project?
So the section where you can write in.
Yeah, section 2.
Yeah, so that you can include if you have ideas about areas that are really important.
Okay.
Yeah.
Thank you.
Jen Thao, back over to you. We're just going to finish filling out the forms so we can go ahead and get started on the next funding motion.
Okay. So this was the funding motion that we did not get to this morning because we were waiting for the presentation. The Advanced Manufacturing Apprenticeship Grant 2-year extension. And I believe we have someone who needs to recuse.
Yeah, so Susanna, you're going to be sent into a breakout room. When we are done, I'll bring you back. It'll automatically bring you back after 60 seconds for the leadership reports. So I'm going to put you there now.
Is there anyone else?
I think we're good, Jen.
Oh, okay. Wonderful. Katrina, would you be so kind as to read motion 3?
Sure. To fund the University of Rochester $150,000 per year for 2 years, $300,000 total to extend the Advanced Manufacturing Apprenticeship Grant for 2 additional years to allow for more time to meet the grant objectives and enroll people with developmental disabilities in pre-apprenticeship and apprenticeship training opportunity.
Thank you. And I believe Kim was going to explain, we also had our presentation earlier as well.
Yes, thanks so much, Jen. Yeah, and I'm not going to explain too long. As Jen just mentioned, you guys just saw the presentation. I will just say that, this really should have been a 5-year grant. Obviously, I think everyone heard about all the work that University of Rochester is doing to kind of facilitate people with developmental disabilities to enroll in the apprenticeship program. Obviously, there's been a lot more work on the front end to get people ready and interested in going down that path and understanding the array of advanced manufacturing jobs that are available and that would fit a person's interests and needs and wants. But really, I think an oversight on our part is that this is such a large scale systems change grant that really the scale of it called for 5 years and we only funded it for 3. And so we would like to give them the opportunity to kind of fully flesh out what they're trying to do more of that outreach, work with younger folks, create the network throughout the state and really give them that elongated timeline. So I'll pause there for questions or comments.
I guess I had a question in watching their presentation. And they talked about the participants and that they can draw from a very diverse population of participants. But so I'm wondering how many participants actually are people with developmental disabilities?
So everyone that they are counting for the grants excuse me, she had said, I think 8 people are currently enrolled in the course. So everyone that they are counting as far as the grant are people with developmental disabilities. They can reach out to broader audiences, but everyone for our purposes that they are targeting is people with developmental disabilities.
Eileen?
So I just want to get a sense. So for this particular grant, it is regional or is it statewide?
It is meant to be statewide. Right now, because of their connections in Rochester, it has been regional, but that is something that they would do in this 2-year extension is branch out. They do have, and you know what, I'm not fully capturing everything. They do have an advisory group in the Hudson Valley. So Fala Technologies that they referenced is in the Hudson Valley. So MACNY is out in Rochester or Syracuse, and they're working with the Rochester Technical Assistance organization. So I guess it's localized, but throughout the state, if that makes sense. So there's pockets, but what they want to do is kind of create a stronger network across more areas of the state.
Katrina had a question online, Kim. How does OPWDD support this outside of job coaching? Because I know they don't approve for individuals to take certification courses.
Yeah. So, and I know that this question came up at our executive committee meeting several weeks back. So I think generally, Allison, you'd be able to respond as well, but OPW is in support of this initiative and thinks that it's a valid initiative. The beauty about the apprenticeship model is that the courses are paid training. So a person isn't paying to take the courses and learn the skills. They're actually being paid by the employer because that is the value of the apprenticeship program. It's on the job paid training. So so the fact that OPW doesn't fund or won't pay for courses like that doesn't actually affect people in this going down this pathway because they're already considered an employee at the advanced manufacturer, and the advanced manufacturer has buy-in and has invested in that person. And so they are supporting the person taking courses and the person learning the skills and logging the hours in order to get that credential. So there's no out-of-pocket expense for the individual person interested in doing the apprenticeship.
Other questions or comments? Okay. Are we okay? Hey, Jen, back over to you, Jen Thao.
Are we ready to move to a vote?
I'll make the motion.
Thank you. Is there someone else who would second the motion?
I'll second.
Katrina on the second.
Thank you.
Great. Let's take it to a vote. All in favor? Opposed by the same sign? Any abstentions? Okay. The Advanced Manufacturing Apprenticeship Grant 2-year extension funding motion is approved. Okay, this time we'll return to our leadership reports. That's okay. Okay, we're in good shape. The caucus report will be given by Shamika Andrews. I'll do the chairperson's report. Vicky Haifa will do the executive director report. And the fiscal report will come from Jesse Kendall. You can just go ahead and give your reports. I won't reintroduce you. Shamika?
Hi, everybody. So the caucus met last night. We had a presentation given by Mary Beth Schneider from Our Ability, who has a new website. They've updated their website, which has employment, job resources, employers that are looking for employees, and a job searching tool, and a tool to help people build a profile online to get connected to employers. So we had that presentation. We also had a discussion on what gaps were present, because this particular tool wouldn't necessarily be for everyone. So we talked a little bit about what those gaps were. There was some conversation on civil service jobs, which we will be what's the word? Well, there'll be more to come on that, and more presentations and conversations. Another thing is we reached out to, caucus members to say, what topics you would be interested in. There was conversation on, making the most of our caucus meetings, and the fact that people wanted to have more conversation. So, and the idea was presented of having more lunch and learn type things, presentations, and then using the caucus meeting as a follow-up to those presentations. So we can have the presentation, then come to the caucus meeting and say, okay, what did we think? And what are the things that CDC, I have to catch myself. What are the projects that we can work on based on whatever that presentation was? And I did have a conversation with Jennifer earlier. What I'm going to do as caucus chair is, as we have these meetings, keep a running list of the topics that I see people mentioning, and we'll use that as a way to say these are the presentations that we think people would be interested in based on what came up at the meeting, and maybe projects that we can present in the future based on those topics. So that's the caucus report.
Thank you, Shamika. For my report, first of all, I would like to recognize a couple of people. Congratulations to Katrina Hazel, chairperson of our Individuals and Families Committee, for her new organization, Disability Champions Mentoring Network, as well as her story being featured in Caribbean Life online magazine. Congratulations, Katrina. Also, congratulations for Xavier Skeeter, who now serves as chairperson for the Community and Systems Change Committee. Congratulations. And in February, Jen Thao will lead the full council meeting, and Sean Foltz will lead a subsequent meeting that's not currently scheduled. So we want to get more people involved in getting experience in leading meetings. It's very important. I was invited to assist in various trainings by the National Association of Councils on Developmental Disabilities. For council members and new chairs, I drafted course syllabi, one focused on being a council chairperson, the other on executive director training from the perspective of a chairperson, which sounds absolutely strange until you realize that chairpersons are trying to understand and have a good rapport with their executive director. And so it was very, very satisfying to see people growing in their understanding. I created an online plan for NACD on new council member training, produced podcasts for training of council members, and designed and presented a day-long session for new council chair training at the recent NACDD conference in Orlando, Florida. Cheryl Matney, executive director of ITC, many of you know her, recently confirmed that I will be doing basically the same work this year, which I'm looking forward to. I really enjoy it. Finally, I'm doing, thank you. Thank you very much. It's very encouraging. Finally, I'm doing content edits for Multiple Systems Navigator, and they don't want that to be the name of it because it's a bit of a pill to swallow, but it will be something that very short and very catchy, and people working on it are immensely creative. But I've had the opportunity of doing some of the content editing for the Deputy Commissioners Cross Systems Council on Children and Families under the Department of Health for this project. This website, I am confident, will offer easy access to agencies, operations, and resources according to an individual's phase of life for individuals and families. It's absolutely brilliant. The organization of the site is organized by phases of life. If you're in this phase of life, you can look here and then look to the next one if you're 10 years down the road. The emerging site is attractive and easy to navigate. It contains a lot of uplifting photos, positive photos of people, families, individuals enjoying themselves. I believe it will help individuals and families as well as increase agency use, both of which are important. Thank you for your attention. Now we'll have an executive report from Vicki Haifa.
Thanks, Dave. And I think that website, as some of you will recall, was created initially through council funding. So really pleased to hear the developments with that website. So good afternoon. I know some of you probably were surprised even that I was still participating in this meeting, since I said my tearful goodbyes at the last at our last council meeting in June. But as many of you know, particularly those in state government, things work at a slow pace, and it's taken longer than expected for our new executive director, Kristen Proud, to officially start at the agency. I am pleased to announce, she might have shared with you when she was there this morning, but her official start date with the agency will be November 6th. And I'll be spending that first week with her, meeting with her and making sure she's meeting with the right people in our, all the people in our agency and all the significant stakeholders. And then I will be using my vacation time after that and retiring in December. So I'm going to really keep my remarks brief since we don't have a lot of time. I was so thrilled with today's meeting and all the questions and comments and just level of engagement among the council members. Please continue that. I can remember some meetings where there just wasn't as much engagement a while ago. And it's just so nice to hear all of your comments and questions. As I always say, it makes our projects better. again, I'm not going to talk about any more accomplishments. I did that last time. I just first wanted to welcome our new council members also, Vincent McLaughlin and Mary Ellen Adams. I'm so sorry. As I said last night at the caucus meeting, I wasn't able to personally welcome you, but I wish you a lot of success in your membership. I also wanted to, I know you're all aware because we've sent you emails and you've seen it on social media. You know, our name's officially changed to the Council on Developmental Disabilities. That was a result of legislation that was enacted by the governor, but wanted to make sure you are also aware that we have a new member rotation policy for caucus members. So council members now, this was also in the legislation, council members now are appointed to 2 full 3-year terms, or a total of 6 years. And now you will no longer have to go through the reappointments process after the first 3 years. So really you will have a term of 6 years when you're newly appointed, a full term, and then you'll be able to stay on until a replacement member is found. You can rejoin or look to rejoin the council after 3 years after leaving. So you do have an opportunity to rejoin if you are interested, but you have to wait 3 years. I also want to just quickly let you know that we have implemented a new process for selecting new council members so that we really get more involvement from our membership. This is really a best practice that most other councils use that we had not been using. So going forward, anyone that applies to be a new council member, we are going to bring those priority applications. We're going to do our own internal vetting, and then we're going to use the nominations committee the executive committee as our nominations committee. And we meet with them 3 times a year. So we'll be bringing those candidates to those to the executive committee meetings, or as necessary to other meetings if they are our priority candidate and we need to have them filled sooner than the meeting schedule would allow. So just wanted to let you know that we will, now officially have a nominations committee as well as our other committees. As a result of that, and as a result of the changes that were made in the legislation, we do need to revise our bylaws. I've already had conversations with our general counsel, and we are working on changing our bylaws to reflect the new legislation as well as the new nominations committee. We also we have a conflict of interest policy, as Jen talked about, but we're trying to make it more accessible. So we're working on that, and we also are working on a new or a revised code of conduct. So we're going to have 3 different documents to bring to you at the next meeting. Krista Rock our general counsel will be at the meeting to walk you through the necessary changes because we will need your approval on all 3 of those documents. So the other thing I wanted to mention, I don't know, I guess we have a little time maybe to do this. With our name change, we did have an opportunity, or we had to go to our website and really make significant changes throughout our website. And I want to thank Drew for overseeing this process, along with Anna, who did a lot of the changes on our website. So we really reorganized it, and I think made the information that we have on our website more accessible. And I do think there's just some great information to share. So I'm wondering, Drew, I'm just looking at the time, if we could just do maybe like a 5-minute overview of our website and how it looks now. Yeah, that would be great. If you think we have enough time. Thanks, Drew.
Yeah, we'll make it quick. All right. So yeah, we've been looking to make a lot of changes to our website really over the last year. And actually at the February council meeting, we had shown some initial changes. But with the implementation of a new name, it really gave us a good opportunity to look at the website as a whole. How can we better communicate who we are, what we do? How can we give better information to our members? And how can we better support our grantee network? All of those were looking to be accomplished while we were doing the rebranding of the website as well. If you are familiar or you have been to our website, I do want to. Can people see it on remote?
We can't see it on remote. That's the only thing, but.
Let me drag it. All right, how about now?
No.
Still not?
Nope. Unless somebody else can say something that I'm not.
It is shared onto this second screen.
When you shared screen, did you share did you share PowerPoint specifically, or did you share screen 1 or screen 2 or etc.?
I'm going to stop the share and then I'll restart. All right. See you now.
Yes, thank you.
All right. Apologies for that. Thank you, Bella. All right. So yeah, we wanted to really look at our website and see how we can make it more useful to really any of the stakeholders that would be visiting it. So I'll point you folks into the direction of a few different updates that we made. One, we have our council membership page. So if you are interested in learning more about what it means to be a council member or get a list of our current active membership, if you are interested in connecting with folks that you've been able to connect with today, or remember whose names are, or who everybody represents, you can come to this section of our website. There's also some council member resources. So there's some orientation videos when we have kind of like those lunch and learn series. If that's a route we go, we can post those here. So we're hoping to be able to build off of this and really make useful information for our members to better understand who we are, what we do, and the different ways that you can contribute. Another area that we made significant changes to is our entire grant section. Most of these are new outside of the available funding. Our funded project section is one that we put a lot of work into. We did have this before. It had very minimal information, but now there is information on every grant that is being funded in the current state plan. You can filter through by the state plan, or there's also a search here. So if you're interested in certain content area, employment, housing, you can type that in, and then it'll give you, again, all of the current projects that are currently under here. And I'll click on one, for example, and it'll give you project summaries, project goals. One thing we want to add to here is project impacts. So you can learn not just about what the grant is supposed to do, what it actually has done. So we really hope that this will be a way for members to be able to, be a little more engaged with some of because we have a lot of different projects and it's very difficult to bring them all to you. We covered a lot today, but there's a lot more that we weren't able to cover. So this would be a spot where you can look at that. We have a policy page as well, which I think Jen Goldman, she has been kind of leading our efforts in the policy area. You can find different policy papers with information on some key focus areas. Currently, we have voting, digital equity, transportation, and employment, and we have more in the works that we're looking to add. So there's the different sections with resources and our policy papers. And lastly, I wanted to show you the news and publication section. So whenever there's any general announcements coming out about the agency, press releases to new grant awards, major initiative efforts, you'll find a lot about our Willowbrook project, a lot about different announcements, interagency collaborations. You can find that all here. So if you're ever thinking, I saw something in the newsletter and I'm curious to revisit it, this is always a good spot to check. And of course, let me know if you have any thoughts. I know we have a communications work group now that we're hoping for folks to continue to be involved with and to continue to give feedback on how we can improve both the website and our internal communications. So we really do want this to be a better resource for members. And the last thing I'm going to share is a grantee resource center. So one of the hardest parts, I think, for our grantees is to do a lot of the admin that we require. We require a lot of the data collection, frequent reporting, and we really wanted to build out a better way for folks to get information, commonly asked questions, so they can spend more time doing the work of the grant that we are asking them to do and less time trying to report some of the stuff back to us or getting bogged down in administrative processes. So with that, I will close this out. I think I'm going to need to reshare again, but I'll send it back to you, Vicki.
Thank you,
Before you
Drew.
go back to Vicky, I just have two quick comments. First of all, Vicky, there was a beautiful cake here that you were not here to see. It was really very impressive cake, and I'm sorry that you missed it. And secondly, I just want to recognize the staff again for all their work on the Willowbrook piece. That was really, really, really impressive. It reached the widest audience I've ever seen the DDPC. That's going to take me forever to get used to the CDD reach. So I just wanted to recognize the staff again. I'm sorry to interrupt.
No, those were really good comments, and I really appreciate that, Colleen. And you were there at the screening, which I so appreciate too. But anyway, I really encourage all of you to check out our website when you get a chance, because there's really some great information on it. So I'm just really proud of all the work that's been done on it. So I'm going to close, as I said at the last meeting, and it bears repeating. It's been an absolute pleasure to serve as the executive director for these last 3 years. And I truly have enjoyed meeting and working with each and every one of you. I'm just so proud of all that we've accomplished, but I know there's more work to do. And I really look forward to hearing about all the great work that you're going to be doing in the future. So thank you again. And thank you for giving me this opportunity to serve as your executive director these last 3 years. Thank you.
I just wanted to say something quick if I can. You're gonna be missed, Vicky. You know, didn't get a chance to meet you in person, but thank you for all you've done these last 3 years as exec director. Come back and visit. We don't bite. But certainly thank you for all you've done, and also for me personally.
Thank you, Vincent.
Thank you, Vincent, and thank you for your perseverance in joining the council. It was a long wait for you, and I really appreciate your patience.
11 years, by the way.
It's a record.
Okay. And I will add that it's because his application got lost, okay, by you know, a long time ago, before my time. So it had nothing to do with the governor's appointment process.
Thank you, Vicky. Jesse Kendall has a fiscal report for us. Jesse?
Thank you, Dave. And just a quick reminder, as everybody, it was noted earlier and also in your packets, that this is the council meeting where you will have to vote on this, but I will keep it very brief. I just wanted to point out, so this is the first time that you're seeing the 24 year that's been added. Now that we're in October, that 21 rolled off, that was completely spent. So now you're seeing only the active grant awards as of right now, which is 2022, 23, and 24. 22, we did request and was approved for the extension. So we just needed a little bit more time due to a little bit of underspending here and there. So that remaining balance, which is accounted for with projects that are currently active, that should be spent within the next 1 to 2 reporting periods. Everything that was voted on today totaled $850,000. Out of that, just as Kim and Jackie had pointed out to earlier, that, you know, we're approving a lot of projects that we have ready to go for the future. So that's why a lot of that total amount that you voted on will be for future grant awards. So the 75,000 that you're seeing will impact that 2024, which obviously will be the apprenticeship program, the extension of that existing grant. So the fact that we're only less than a month into the 2024 and we already have all these projects lined up and earmarked for that grant award puts us in a really great position. And if there's any kind of, you know, issues with underspending, we're ready to spend with any or fast track any future projects. So we're estimating that 2024 grant award to be $4,200,000, which is right around our average. We won't know that exact balance till towards the end of the grant award, just like that 2023. Now that should be our final balance with that. I will leave it at that, and I will open it up to any questions in the room or online. I was telling Vincent, I brought a laser pointer this time. Next time it's going to be fireworks, sparklers to make this more exciting.
Hey, I like a little entertainment.
If no one has any questions, I'll pass it back to Dave and Jen for a vote, but obviously I'm always available if anybody does think of any questions afterwards. Thank you folks very much, Dave.
Thank you, Jesse. Jen, over to you for the vote.
Thank you, Dave. Are we ready to end the discussion and move to a vote?
I'll move it.
Thank you. Is there someone who will second?
I'll second.
Katrina.
Perfect.
Thank you.
Take it to a vote. All in favor? Opposed by the same sign. Any abstentions? Okay, the CDD fiscal report is approved. Thanks again, Jesse.
Thank you. Thank you, folks.
Before we adjourn today, our next full council meeting will be February 14 and 15. The caucus will be the 14th, full council 15, 2024 at the Desmond here again, and will be online as well. It'll be hybrid, basically. It is with sadness that we say farewell to Vicky Haifa, our outgoing executive director. I think I speak for all of us, Vicky, when I say well done. Thank you for your extraordinary service at a very difficult time in our agency's life. We'll never forget COVID, I'm sure. We in the agency are the better for your faithful and exceptional service. Thank you, Vicky. And if you were here, we would be lining up for hugs. For those attending remotely, you will see a meeting feedback survey link in the chat box. Please fill that out before you leave the meeting. Those of you attending in person will see the feedback survey form in your folder. Please fill out your survey and other forms noted today and return to staff at the registration table on the way out. If there's no other discussion, I'd like a motion to adjourn, please.
I'll move it.
Okay, Vince. And a second? Okay. Sean? All right, very good. The CDD full council is adjourned until February 15, 2024. Thank you for your contribution today and every day, and have safe travels wherever you go.